Boop, boop, boop. Hello. Welcome to the workshop. Presentation. Okay, boop, boop, and boop. Okay, welcome to my voice modification workshop. We'll be going over all of trans voice, whether you're masculizing, feminizing, or androgynizing. Androgynizing, hint, is just masculizing or feminizing, but you stop sooner. I know, Beth, my hair. I have new hair, as you can see. This got done literally yesterday. You can't hear me. Everybody should be able to hear me. Trans Academy, let me know if there's an issue. You hear me? Okay, good. If we have screen stuttery stuff, you'll have to live with that because Discord can get real funny sometimes. I haven't found a way to fix that yet. But yeah, so welcome to the voice modification workshop. My resolution is terrible, but that's Discord. Yep, I can't fix that, I'm afraid. Okay, so workshop rules and etiquette. This is really important. Essentially, it's just for the people in Discord. Please be respectful of the learning environment and be respectful of the people around you. That mainly means keeping things on topic and trying to avoid interruptions apart from like the specific areas that I ask for them. Questions are always fine and questions are heavily encouraged. If you're ever not following or you're struggling or you just have a question, please let me know, whether that's in chat or out loud. But if it is out loud, wait for me to ask any questions so we're not interrupting the flow of stuff. Also, when we're, inviting people to talk, try to keep things on topic. I don't necessarily need to hear about, I don't need to hear that, oh, you found this really easy necessarily, or I don't need to hear that, like, what your dinner was. Keep it to questions and keep it to being respectful of the other people here. Are there any questions about that before we go forward? There's an example of me asking. You can speak out. Yeah, any questions before we move forward? No questions. All right, let's go forward. Oh yeah, at the end we'll have an open forum section. This is where if you want to direct one-on-one feedback, then you'll be able to unmute. We'll go one at a time. The workshop doesn't end until I get through everybody that wants it in the open forum section. So you'll get the opportunity to ask me to look at your voice specifically. And yeah, get that little one-on-one bit. So that'll be at the end. I'll let you know when that comes. You said this is going to be a workshop about resonance and hearing it in voices. This is a workshop about all of voice feminization and masculization. There is a specific segment where we'll go over resonance. It will come after vocal weight. Okay, so fab. All right, let's go forward then. So firstly, who am I? My name's Zara. I've been working on my voice since November 2023, something like that, about a year. Actually, no, we're coming up for more than a year now. I need to change the slide here. So just over a year. I would label myself as an aspiring vocal coach. I don't present myself as like the real deal yet. I'm still building experience and building knowledge. But hopefully, eventually, we'll get there one day. So I'm still building knowledge right now. If I say something that conflicts with another professional coach, then, go with what they say or like have a discussion with me about it and see why I differ. So that's important. Not a professional yet, but I hope to be one day. Important of what I'm not. So we've gone over I'm not a professional vocal coach. Really important though, I'm not a medical professional, okay? I can never ever diagnose you with anything. I will never ever be diagnosing you with anything, and I can never treat a medical condition. The closest we ever get to anything like that is if I hear something and I'm hearing something that sounds similar to a condition that I'm aware of, then I might recommend you speaking to a doctor. That's all I'm ever doing. I'm just giving you a recommendation. You could speak to the doctor and they're like, no, you're all clear. And then, okay, you're all clear. It's never of a diagnosis. It's never of a treatment. It's just suggesting a conversation. That's it. Any questions about that before we go forward? Because that's a really important bit. Nope. Oh, we have somebody typing. How long will the workshop be, give or take? It's always a bit different. Usually they are at least 2 hours. The longest has been 4.5 hours, but we've never had one come close to that since. But usually between 2 and 3 hours. Just over 2 hours is probably the average. Okay, so on to some actual voice stuff. So we'll start off talking a little bit about maintaining vocal health. So as you go through the workshop, you know what you're doing to keep things nice and safe. And as you go through your voice journey, this is going to be good stuff to keep in mind, just to make sure you're doing things in healthy ways. So important things to be doing is staying hydrated. Water is super key to doing everything with voice work. You really, really want to be in a nice and hydrated position. That's why, for those in Discord, I asked you to drink a pint of water an hour ahead of time. The reasoning for such a lot of water, there's not a ton of water, but a pint of water like an hour ahead of time. The reasoning for that is it takes quite a while between you drinking water and that water actually rehydrating your vocal folds. Because when we drink, you'll think of when people choke on some water or something, people often say, oh, it went down the wrong hole. They are actually literally correct there. You have your pharynx and you have your larynx. When you drink food and water, it all goes through the pharynx, not the larynx. All of your voice stuff is in the larynx, okay? People often call it the voice box, all right? That's all laryngeal stuff, okay? None of that is getting hydrated unless you're choking on your water. None of that is getting directly hydrated when you drink. So it has to go all the way through your digestion into the bloodstream, and then blood has to come to the vocal tract and start hydrating things. So it takes quite a while. It's good to be aware of that. Is tea okay for hydration? Tea is okay. Although I doubt you're going to be drinking a ton of tea quick, but it depends on... Oh, unless if you're talking sugar tea, like that sweet... It's a thing in America. We don't really have it here. We have Lipton sweet tea, I suppose. Sweet tea, if that's going to... Look at how much sugar's in it. If there's a lot of sugar, then that's probably going to be dehydrating you a bit. I would rather you be drinking water. You're Southern? Yeah. So if it's a sweet tea, I would imagine it's probably going to have quite high sugar content. And it's probably not going to be the most hydrating thing. We'll talk more about that soon. Carbonated water, that's totally fine. Yep, that's totally fine. Okie dokie. The other thing is, would Arizona iced tea count as sweet tea? Almost certainly, yeah. I'm just talking about the sugar content. If your drink has a ton of sugar, it's not going to be very hydrating. Water is always best, guys. Drink water. It's good for you. Yep, go get some water. It means driving home. Jesus. Okay, so the next really important thing for keeping yourself in a good vocal health is going to be making for sure that things are really relaxed. This is going to be super, super important in all of your voice work. If you're just staying nice and relaxed, that means your vocal posturing is always, you're going to avoid vocal injuries and stuff. And you're also more likely to you're going to produce better sounds. When you're talking normally, you're normally in a pretty relaxed state. Nothing's super crazy or effortful. The same should apply to your modified voice. None of what I'm doing right now is effortful or difficult. It's precise and it's difficult on a technical aspect, but I'm not going to the gym right now. This isn't, no muscles are being built. This is no harder for me than talking normally, in terms of that physical aspect. For YouTube, when I do that, I'm just looking over the Discord chats to see people's questions. You drink a mouthful on the hour every hour. That you should maybe increase that a little bit. I think about 100 ml an hour is probably a good amount of water. Yeah, I would aim for about 2.5 litres of water a day. If you're on spironolactone, then you might want to increase that a little bit, because spironolactone is going to be making you urinate more often, and you're going to be losing a lot of that water. Or any diuretic, really. You want to be drinking more to compensate for that diuretic. So yeah, keeping relaxed is going to be really important. Yeah, just stay relaxed. Things shouldn't be very difficult. It should be just as easy as talking normally. Warm-ups. Warm-ups are going to be really, really helpful. When we warm up, we're going to be maintaining good mucus levels. If we have too much mucus, we'll clear it out. It will increase our blood flow to the region, which is going to bring that hydration in, which again is going to help for basically everything. That extra blood flow is going to make things a bit more, what's the word? Nimble, a bit more lumbar, so things are just going to move more easily. If I find that especially like on a morning, my larynx, I can barely move it. I can't really move my resonance very much. But if I do some warm-ups, that can very quickly go away. So warming up is going to be really good for you. It's going to help you avoid injuries. And it'll help you in your recovery as well, if you have experienced an injury. Also, have fun, okay? Voice work should be fun. We should be exploring, okay, and having a good time as we're doing it. This is like so much more than most things where they say, and have fun with it. This is like, you will genuinely benefit if you treat this as like a fun sort of little thing that you do, okay? When we're trying to learn different things with our voice, try to think of it as like, oh, I'm going to do some silly voices for a while. This is going to really, really help you to be exploratory, okay? Checking out all these different things you can do with your voice, because the more exploratory you are, the more things you're going to discover, and the better you're going to be at modifying your voice. If you think of like your voice as being like, what do you call it? Like a mixing desk where you've got all these little dials that we can put up and down. Your voice is like all of those dials being moved in different places. So the more we explore our voices and the more we play with these dials and learn what each of them do individually, the better we're going to be able to be at producing any sound we want to produce. So really have fun with it. Explore stuff. Don't put a ton of pressure on yourself. Again, it's keeping that relaxed sort of thing going on. That mindset will just, you will grow so much faster if you just keep things relaxed and have fun with it. If you want Cypro, I have no idea what Cypro is, so I have no idea. But if that's a diuretic, then you might need to drink more. I imagine you can get information on that just by looking up the drug. It's just a matter of if more water is going out, more water needs to come in to compensate for that. That's all it is. Or like if you're working out a ton, or if it's a really hot day, you're going to be sweating more, you need to be drinking more. It's just simple staying hydrated, you know? It's another anti-androgen. Yeah, I don't know anything about it, I'm afraid. You'll have to look that up on your own or speak to your doctor about it. I imagine you're getting that from an endocrinologist, so speak to them about it. Ask what it does. If it dehydrates you, then you need to be rehydrating yourself as you go. Yeah, I had to speak to your doctor about that one. Okay, things to avoid. Now, these initial ones aren't a big deal. It's just they can affect things a little bit. So, spicy foods. The capsaicin can irritate the vocal folds a little bit. People often like cough and sputter a little bit if something's a bit too spicy. So just keep that in mind, that it can irritate the vocal tract a little bit. It's not a huge deal, but like, don't be having chilies right before doing voice work. That's silly. Again, you can still have spicy foods. Just keep it in moderation and don't do it right before doing like a bunch of vocal stuff. Caffeine also irritates the vocal tract a little bit, just a little bit, and it dehydrates you as well. So again, make sure we're drinking plenty and just keep things within moderation. If you're having like 8 espressos a day, you're probably having too much. It's probably going to affect all sorts of things with your health at that point. But just keep it within moderation. Again, a strong coffee right before voice work is probably a bad idea. A hot tea is totally fine, like a British tea. or herbal teas are going to be wonderful. That warm liquid can be really good for just, again, warming things up. Sugar's another one. It's just a simple, it dehydrates you. That's what I was talking about earlier with the sweet teas. Sugar can dehydrate you, so keep that in moderation. Again, a ton of sugar while you're doing or just before doing voice work, it's probably not going to be a good idea. But yeah, just keep that in mind. I'm going to skip smoking and smoking vaping for a moment. Dairy, again, not a huge deal. You can have dairy, but maybe don't have a pint of milk right before doing your voice work. Dairy specifically will increase mucus production. Earlier, I did mention that mucus production being a good thing, and like hydration provides mucus production, but dairy will just make you produce, regardless of whether you actually need any more. So let's say we have like optimal mucus production at that moment, everything's totally fine. If you drink a bunch of dairy, things are going to start just creating excess. So just keep that in mind, keep it in moderation, maybe not right before doing a bunch of voice work. I'll check question real quick. Yeah, you can. Oh, you just ate cereal? Yes, you might find yourself being a bit more mucusy, a bit more coffee, and clearing your throat a bit more often. The softies that we'll do soon might help with that. If you do find that you are mucusy, then the warm-ups that we'll go over in just a moment, they're going to help you with that. You've never had British style tea. You're not living. You need to have British style tea. It is gold dust. It is the liquid I could live off. No eating chocolate during voice training. Yep. Even a little bit. Okie dokie. So, again, all those ones I just mentioned, they're really not that much of a big deal. They're just something worth keeping in mind. But it's not that big of a deal. Don't worry about it too much. The next ones I want you thinking about more. Smoking and vaping is a really obvious one. It's obviously going to damage your vocal tract. Everybody knows this. I'm not going to hype on it. Again, you can modify your voice as a smoker or as a vapor. It's just going to make things a bit harder. You're going to be a bit more prone to injury. So just be careful and keep things in moderation. You don't have to quit today. But, I mean, you know that smoking and vaping isn't good for you, so I don't have to go over that too much. Hi, Sifrin. Glad you can come. Sifrin, check out my new hair. You're very welcome for me hosting. Okay, so the next one's really, really important. My new hair. Look, I have new hair. It is new. It is cool. Oh yeah, my camera might be a bit shit right now, but whatever. Okay, so the next ones are going to be a bit more important. I do want you actually having like real-time focus on this, okay? If you're experiencing any strain in your voice, any pain or discomfort, or any tension, these are big no-nos. Especially pain. Pain means you are damaging something. Now, this isn't like the end of the world. You're not like destroying your vocal tract. But it's something that you do want to be paying attention to. Whatever you just did that caused that, it was wrong. You should never you don't need to experience any strain, pain, discomfort, any tension, anything like that. None of that is useful for voice feminization or masculinization or androgenization. It's only going to set you back. If you were to cause a little vocal injury, then you're probably going to need to take a few days off of voice work, and that's days you can't practice. So just keep that in mind. It's not good for you. And it's not going to produce the sounds you want it to produce. You know, if I go like this is me talking with a ton of constriction. If I did that a whole bunch, one, it wouldn't sound very good. It'd probably make me sound older, which I'm not going for. But it would also damage my voice over time. If you were to repeatedly push through the pain and just keep going, eventually you could cause more significant injuries. We can get like little nodules and little scar tissue that forms on the vocal tract, and those have to be surgically removed. So this is something to think about. I don't want to like scare you. It's almost certainly not going to happen. As long as you know pain means stop, evaluate what just happened, avoid it in the future. Okay? It's never the whole no pain, no gain adage is the complete opposite in voice work. We aren't like, I'm not trying to build muscle here. You're not trying to build muscle here. You're just learning how to do it. Yeah, I hope that's really, really clear. Do you have any questions about that from anyone? Yeah, pain equals loss. Pain is always bad here. It is nice. Thank you, Sifrin. If your earbuds are causing pain, discomfort, then yes, they're probably hurting your ears. Okie dokie. How do you find out if there's any permanent damage? Ask your doctor. You had about 8 years of winging it with voice, and then 2 years of course correction through Trans Academy and Trans Voice Lessons. Yeah, ask a doctor if you're worried about those. Doctors absolutely... Oh, you're saying Raycons are a scam. Yeah, maybe a little bit. Yeah, ask your doctor, and they'll refer you to a speech-language therapist, or is it oncologist for vocal tract? I'm not quite sure. A throat doctor. And yeah, they'll stick a little camera down your vocal tract and take a little look. But like, you'll know that something's wrong if there's permanent damage. But absolutely go ask your doctor for medical advice. Okay, moving forward. So, I told you earlier that relaxation is going to really help you. I also mentioned how strain is going to be really bad for you. They're kind of diametrically opposed. So, let's avoid tension and strain. Let's get ourselves nice and relaxed. So, if you can all get yourselves into a really comfortable position. Yeah, get yourself in a nice and comfy position. And we're going to do a little breathing exercise, okay? This is just to help us relax and help get our bodies in line with that relaxed posture. Even relaxing like your whole body is going to help you relax your vocal folds, because just your brain is going to be just relaxing everything, which is what we want. That's going to really help us. So if you want to just do a little breathing exercise, you can follow me as I do it. So breathing in, hold, and breathe out. Breathe in, hold, and breathe out. Once more, breathe in, hold, and breathe out. Okay. All right, so try to maintain that same level of relaxation as we go through the workshop. Hells yeah, please see more people using the TN Discord. Oh, you know what? We're about to get into things, so before I do, I'm going to plug my stuff, okay? If you would like more from me, then you can join my Discord. Link should be below me somewhere. I think it's that one. Yeah, join my Discord, Trans Network. I have... Oh, apparently there's better resolution over there. But yeah, I provide all sorts of resources for people. I provide free private lessons. Right now they're closed just because we're full up. But as soon as they open again, you'll be able to apply for those. So yeah, literally free private lessons, as well as me all the time. You can always ask me questions there. I'm always happy to help people over there. Yeah, so check out my Discord. That is the best place to get everything me. And then check out the YouTube for constant like updates and stuff. Eventually, I will release a bunch of videos just like going over the process. I've been saying that for like months so bear with me. It might take months still. I'm just very lazy. But yeah, we do have other bits of content. We do have a really nice community where people can hang out now. So yeah, I highly recommend both YouTube and the Discord. Okie dokie. So moving on to some voice stuff. It's going to be really useful. Let's start off with some warm-ups so that you guys can be all ready for doing your actual voice stuff. So we're going to be doing softies. Hello? I don't know what that was. We're going to be doing some softies. So that's a semi-occluded vocal tract exercise. Okay? Semi-occlusion means partially closed. Okay? Vocal tract, you know what your vocal tract is, and you know what an exercise is. So the idea is we're going to work out the vocal folds while having a partial blockage in the front of our vocal tract. In practice, we're going to have our lips. You can see there's a partial closure there as I'm sort of doing that little lip trill. Or we could have like a tongue trill. Or we could have like a ying, or an N sound, or a Z, zzz. The only one we can't really do is a hum. Humming, I still need to look at the study that actually describes this, but humming doesn't give you the same... somebody just asked that exact question. Humming doesn't give you the same benefit as all the others do. So avoid humming, stick to the others. I find for most people, the lip trill is the easiest. Most people really are very comfortable just going... For those that struggle with that, and if you're really struggling, move to one of the other ones. You can even do like a... Just make sure you're having that like small hole being made. Any questions about that? Does that... Hopefully it's relatively intuitive. And then what we're going to be doing once we're there, okay, is we're going to be moving our pitch slowly back and forth from high to low, going further and further and further and further. You feel stupid, you don't really understand the third one. The strophination, I'll describe that in a minute. Don't worry about that. Yeah, so the pitch, imagine like a pendulum. Pendulums kind of swing around and slowly run out of energy. We're going to do the opposite, where we do a small movement and go further and further with our high pitch and our low pitch, further and further until we get the ends of our pitch range. Okay? That's going to sound something like this. Okay, and you just go further and further out each time. So, if you guys... Oh, and we'll quickly cover strophination. Strophination is a unique one. Those ones are always really accessible because you can just do it. A strophination, you need stuff with you. But strophinations are absolutely the best softy. You will get so much benefit from strophinations. The reason that we're doing these softies is essentially, imagine as you talk, okay, you have your lungs are pushing some air out, okay? That's going through the vocal tract, up the trachea, into the larynx, passing through the vocal folds and the glottis, okay? As your vocal folds open and close, they're chopping that sound up, which is creating pitch. So every time your vocal folds open and close, that cycle, okay, the amount of times it does that cycle within a second is your pitch. So for example, if you're talking at like 200 hertz, that's 200 opening and closings a second, okay? That's just literally what pitch is. We'll cover other stuff as well if that happens, but it continues up and then bounces around, which is going to add some extra modifications and eventually comes out of your mouth. But you can imagine as we're doing that, all that air is coming through, all pushing up. That's a lot of upwards pressure on your vocal folds, okay? By doing the softies, we are counterbalancing some of that pressure, so there's just less on them. That means they can stretch out and be a bit more comfortable. They can just have a nice stretch out without having all of that pressure, okay? By having that partial blockage, you're creating a backwards pressure to counterbalance some of that upwards pressure. Does that make sense? So it's just going to be a bit comfier for your vocal folds to stretch out. Hopefully that is reasonably clear. A straw formation, by the way, the idea is essentially for water will give you the perfect like bounce back for that pressure. Okay, so you take a straw, you'll dip it in about that much maybe. You'll be able to feel sort of a pressure as you go in. Tip it in the water and you just start blowing bubbles. Then from those bubbles, start phonating, start making a sound through it, okay? And then we can just do that same thing where we're moving our pitch side to side, okay? So if you're doing your straw phonations, you'll just be going... Or if you're doing your lip trills... Or if you're doing your tongue trills... Do you need to put it in a glass of water? No, anything that contains water will be fine. I don't recommend a glass of water because it's going to splash everywhere. If you have some kind of cover, like works in a bottle, then it's just going to have less splashing. I also recommend have it about half full. Again, it's just so that you don't splash everywhere. You totally can do it in a glass of water, but expect some mess, you know? So we'll start now. If you guys would like to, you could do a lip trill or a tongue trill, whatever works better for you. If you have a straw and a bottle of water available, you do that, do the straw phonations. That's what I'm going to do. But yeah, you can just follow my pitch, okay? With your, whatever softy you're doing is going to be fine, okay? Any questions before we get going with it? Does it need to be submerged in water? Like, is the straw being in water crucial? Yes. We're blowing bubbles into the water, okay? Your straw wants to be about that deep into the water. I hope you can see that okay. About that deep, okay? Although you'll be able to tell if it's the right depth. As soon as you start doing it, you're going to know what I mean. It shouldn't feel like it's a ton of effort to blow the bubbles, but it shouldn't feel like it's no effort, okay? Sort of that happy in between, yeah? Is that nice and clear for everyone? Yep, fab. All right, let's get going then. So I'm going to do the straw phonation. Again, you can do whatever you want. As long as you're doing a warm-up, that's good enough for me. So I'm going to dunk my straw in. Jessie from Trans Voice, would you mind just your mic, please? Cheers.
Sorry.
No, it's okay. Don't worry. Don't worry. Okay, we'll keep going. Your lip trills are like an engine, and you have to hold your nose to stop it vibrating. That's fine, I suppose. Don't like pinch your nose, but if you need to like put your finger on it, I don't know. Oh, you have a deviated septum. Okay, if you have a deviated septum, then things might be different for you. I have no idea. That's definitely past my knowledge level, I'm afraid. It also might be the exact same for a deviated septum. I just don't know. I'm going to do one more, where we go to the absolute ends of our range, okay? Okay, so now that we've found those ends, what I now want you to do is go right up to the top. Yeah, this is just a pitch thing. It's just a stretch out, okay? It's just a warm up. We go right to the edge of our pitch, okay? And then we're going to do a little siren, okay? Yeah? Your individual edge, yeah. And hopefully in time that individual edge will stretch out more and more. But yeah, just go for whatever the end is for you. You have a super high range. Is it more efficient? We're just trying to stretch out the vocal folds and give them a little warm up. So we're trying to go through that entire pitch range as we warm them up. And I'm going to do the same thing going down. Okay, and that is going to be our warm up. Okay, it was the exact same if you're going. Or. Yeah, I totally messed up there, but you get the idea. Whatever it is you're doing, that's totally fine. Also, I'm recovering from a cold, so excuse my coughs and stuff. And clearing throat pretty regularly. Luna, from what you're describing there, the straw phonations might be useful, or you could try it just doing the ying. That's nice and easy for people. Ying. I haven't done that in ages, but you get the idea. Anything like that will do. Or Z. I'm horrible at the Z. I need to practice that one more. Okay, any of those. Any questions about softies, about what we've just covered so far? It should just be a nice and easy warm-up for people. So hopefully it's nice and clear. Lixie, did you just say hi to yourself? But hi, Lixie, how are you doing? Yes, you did. Your chores are dying. So what might be happening is your, excuse me. What might be happening is your, here we go. You might have your lips aren't relaxed enough for your lip trill. Should be nice and relaxed, okay? Or you might be having airflow issues. So just make sure you've got a constant, regular airflow if it isn't changing at all. Hopefully that will help you. If you're struggling with the airflow, try just applying a little bit of pressure to your cheeks so that they don't fill up with air. And that might help you a little bit. Winter is the worst season for voice training. Definitely, yeah. That's why you have to be very careful for doing plenty of warm-ups. Your lip trill has voice crack between M1 and M2. For people that don't know, that sort of falsetto-y kind of a thing versus that like normal talking is like M1 and M2. M2 being that kind of falsetto-y kind of a thing. If you go like, oh, Mickey Mouse, if I'm doing this kind of a voice, this is M2 right now. That kind of a falsetto thing. If there's a crack between the two, you just want to make it a really big crack to start yourself off and then start reducing that crack slowly to make it nice and smooth. You can hear in my voice. I do go into M2, but it's barely perceptible where I switch. So you want to work on that over time. Not a huge deal though. Yeah, make sure you're hydrating yourself plenty. And make sure you're warming up plenty when it's winter time and if you're cold. And throughout all of that, watch out for tension. If you're having a bunch of tension, that is always bad. Straw phonations are always really good for helping you clear up tension. Strophinations are just the best. If you can do strophinations, then do them. But obviously we don't always have a bottle and straw and all of that with us. So if you don't have that with you, obviously just do your normal trills. But yeah, strophinations are always the best. Any other questions about softies? Hopefully they're nice and clear. Just like before, after doing softies, your throat itches, even if not painful. I think the issue is that you don't manage to relax your throat enough. Any other tips? So the strophinations are going to really help. If you're struggling with relaxation, the breathing can help. We can also do, I like to have students do like little sighs. So if I get you to do, really like just melt into your chair with it, like make it a really dramatic, that really, really relaxed kind of a thing can get you to a really nice posture. We could then do that in reverse. And that can bring us into like training ourselves to be more relaxed. Use that and then go do that in your softie. That should help you be a bit more relaxed as well. Okay, hopefully that's nice and easy for people. If you're brand new to voice work, I would say stay here, okay? In terms of your regular practice, ideally I want you practicing like 4 or 5 times a day. That's going to be really useful. If you can do this for like 10, 20, 30 seconds, like 4 or 5 times a day, that's going to be really, really good for your practice. It's a nice sort of training regimen to start bringing into your voice work. But it's also going to be just a really good for like building that vocal hygiene to make sure you're in just a really nice and good vocal health point for going into masculinization or feminization. So yeah, if you're brand new, start here, okay? And just do this for like a week or so before moving on to the other stuff. You need a lip trill phonation, like not a lip trill, but some sort of hum that you can use during meditations. Yeah, lip trill you are phonating. That I'm phonating during that. That's if you can hear pitch, you are phonating. If I don't phonate, I'm like, I'm whispering right now. Right now I'm not phonating, okay? Yeah, but something that's not M but does work. Do you mean staying in M1? If you're just trying to stay in M1, then you can just do that. I don't see why you wouldn't be able to use M2, but... Oh, you want like that kind of a sound, that kind of a sound? So for your meditation? Yeah, Z works, or N. If you want something that sounds like then you could just go... Same sort of a thing, but it's with an N instead of an M. M1 and M2. M1 is ordinary phonation. It's what I'm doing right now. My normal talking is in M1. If I go over into like a Mickey Mouse impression, hi, this is Mickey Mouse. I'm kind of talking over here. This is M2 right now, okay? So me talking right now, this is M2. Or if I go over to here, okay, you can hear my unmodified voice. Right now I'm in M1. But if I kind of talk like this is me talking in M2, okay? That's the difference, okay? It's that sort of falsetto thing. The proper name for that is M2, or vibratory mechanism 2. It's not just high pitch. Note, it's not just high pitch. If I go up in my pitch and I can go over here, that was me. I added a whole bunch of resonance there. I'm at a higher pitch right now, but I'm not in falsetto. But if I go over here, now I'm in falsetto. Do you hear that difference there? Yeah? Me talking over here right now. Me talking over here right now. So it's not just a pitch thing, okay? Your pitch goes up, but a bunch of other stuff happens to it as well. It's an entirely different way of making sound. Your internet is screwing with you. I'm so sorry for that. Yeah, Take On Me. That really high note, he goes into falsetto for that, into M2. That bit in Take On Me that you can't do, that's M2. Okay, any more questions about softies at all? Or we'll move forward. Like I say, if you're brand new, stay on softies and just stay on that for like a week or so before moving it forward. It's going to be really, really good for you. Practicing Take On Me is maybe not going to be the most useful thing because you're going to have to go like super crazy. If you can do it, then do it. But that's kind of insane. Do I need to do the N softie a specific way? No, all of the softies are the exact same way. We're just going up and down in our pitch, stretching out our vocal folds. And just like, or the bubbles. Oh, my camera just died. I forgot to put it on charge. Okay, you're going to be without the camera for the next few minutes. As soon as it has enough battery to turn on again, I will get that going again. Rip camera. Don't worry, you don't need to be able to see me for this next bit. Okay, let's move forward onto our next bit. So, vocal weight. All right, this is going to be your next thing. If you are feminizing, this is where I want you to start after you've done your softies. Okay, if you're masculizing, this is going to be the second thing. All right, but you can still have a little play with it for now. And I'm doing all of these things with my fingers and you can't see them at all. Whatever. So, vocal weight, okay? I want you to listen to these two different sounds. Me talking right now versus me talking right now, okay? Can you hear how there's almost like a buzziness going on in this voice right now versus this voice right now? If I go over to here, okay, can you hear how there's a difference in buzziness between this voice right now and this voice right now, okay? Do you hear that difference in buzziness between here and here? And notice that it's more than just a volume thing, okay? There's a little bit of a volume movement, but even if I go over to here, there's not much of a volume movement happening there, okay? Even though it sounds like there's a big movement of volume there, it's just a small thing. Can people hear the difference between those two sounds? Yeah? What words would you use to describe that difference? There's lots of words we can use for this. I want to hear what are people's intuitions. Hard versus soft. Yeah, I like that. I like that. What else have we got? The buzzy one's kind of nerdy. I imagine you're talking about for the femme voice. Yeah, definitely, definitely. Heavy and light. Yeah. Actually... Yeah, for sure. Nasally versus not nasally. That's not quite going to be... It kind of, in the feminine one, it kind of sounds nasally, but it's not actually nasally. They just sound similar. That's a really, really common thing that people get confused with. My camera should be about to turn back on. Hopefully that can work okay. There we go. Yeah, if I can't go like... You're hearing like... I think it's hyponasality for that one, where like the nose blocks. If I literally just go, if I go like this is nasality, okay? If I'm talking over here, this is nasality, okay? So can you hear the difference between me talking right now and me talking right now, okay? I know that they're kind of similar, but one of them's really, really buzzy. That's that heavy vocal weight, okay? Now what's literally happening is, I talked earlier how as my as air comes up through the vocal tract, okay, it interacts with our vocal folds. All right, the vocal folds are like two little ligaments that open and close like that. Okay, now as I was saying earlier, the amount of times they do that within a second is your pitch. It's not Fry. It's different for Fry. Fry kind of sounds like this. All right. If I'm talking with Fry, that's going to sound like this. Whereas if I'm talking like this is that heavier weight, okay? Can you hear the difference between this sound and this sound? Yeah? Okay, as I was saying, as air comes out, it's going to be chopped up. That's going to be our pitch. How hard the air is coming out? Kinda, but not really. Okay? As we do each of those individual cycles of opening and closing, the more time we spend closed versus open is going to be how heavy it is. Or vice versa, more time open than closed, that quotient is going to be your vocal weight. Okay? Does that make sense? In terms of just the mechanics of this. We're not going to be focusing on the mechanics in terms of how you do it, but in terms of like the concept of how this is actually happening. Does that make sense? Buzzy is heavyweight. Yes, absolutely. It's kind of to do with the air. It's more to do with the vocal folds themselves. The more time they spend closed versus open during those glottal cycles, the heavier the vocal weight. Okay? So you might sometimes in different places hear, so like linguistics, they refer to it as a heavy quotient versus, a closed quotient versus an open quotient. This is what they're talking about, okay? They're talking about what's going on with the vocal folds, where they're actually spending more time closed than open, or more time open than closed, within each individual opening and closing cycle. Okay? Now, a few things about the sound, okay? Because somebody just mentioned, yeah, so volume and weight are super, super linked, okay? When my weight goes up, it sounds louder, even if it isn't. Vocal weight is something that we often apply if we're trying to alert people, okay? So we'll go, whatever it is that is our norm, we'll increase the weight a little bit if we're trying to like alarm people, all right? This goes back to like our hunter-gatherer days where, you know, if a predator's coming and we need to like tell everybody like, holy shit, there's a predator, we'll increase the vocal weight. Like, oh my God, there's a predator, you know? We're being really, really big right now. Everything's crazy right now. There's a freaking lion or something. Or if we're really excited, like, oh my gosh, look at this bush. Oh my gosh. You know, that buzziness is an alert signal. Okay. So for that reason, one, your vocal weight is probably going to be very highly tied with your volume itself. Okay. You're going to find your volume moving with your weight. I want you to try and minimize that. You'll still get some like moving together, but try to just have a small amount of movement change, a small amount of volume change for a large amount of weight change, and vice versa. You can do that. But also you'll find that just the weight on its own makes it sound louder, even if it isn't. You're just paying more attention to the sound. Okay? Does that part of things make sense so far? And then we'll go into actually playing with this. Okay, so let's have a little play with how to actually do this, all right? How to play with this sound. So, I want you hope you got it? Okay, ask questions if you're not sure. Absolutely ask questions. Because if you're unsure of something, so is somebody else. So, in terms of how we actually manipulate this and play with this, all right? I want you to imagine you're holding a little baby, okay? And it's falling asleep, and we're just going to lull it to sleep, okay? Very cute baby. Hey, baby. Hi. You going to go to sleep? Yeah. We're going to talk to the baby in this kind of a voice, all right? Really nice and gentle. If I go over here into my darker area, that sort of more typically masculine area, I'm just going to be talking in this very gentle voice, okay? Oh, very cute baby. Oh, you go to sleep, baby. Yeah, just this very, very gentle voice, okay? This is going to be our lighter weight. You'll note I'm increasing the volume now again, going out of that sort of thinking about the baby. I'm going out, I've increased my volume now. I'm at normal talking volume, but I'm still in that really light weight, okay? For those that dislike kids, yeah, absolutely. Imagine you're petting a cat, okay? Aww. Very nice cat. Aww. Okay, all right, this end. Very nice cat. Yeah? So do that yourselves. Okay? Now on the other end, okay, I want you to imagine that baby has just thrown up all over you, okay? Or that cat has just scratched you, or a puppy bit you, or whatever it is that you're going for, okay? It's just thrown up on you. Gross baby, Or at this end, gross baby, gross, 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 Okay, do you hear that increase in vocal weight there? And now I'm kind of talking like this with that extra bit of buzziness behind my voice. Gross baby, Or puppy, get off, get off. Okay? Or cat, get off my hand, or whatever. You know, that there's urgency to it, there's immediacy to it, there's buzziness to it, okay? There's increased vocal weight, all right? Can you hear that? That increased buzziness. Versus when we were just talking like this, or when we were just talking like this. You can feel the buzzy. Yes, some people will even feel the buzzy. Hard to find the lighter part. Yep, if you're feminizing, it's going to be harder to find that lighter part. And if you're masculizing, it's going to be hard to find that heavier part. Because that's what you're learning to do. So this is what you're practicing right now. Okay? Have a really play with that. Very cute baby. Very, very cute baby. Or if I was to go all the way down here. Very cute baby. Yeah. What should you do if the lightest weight is too breathy? You've run into a really, really common problem there. I'm really, really glad you said that. So sometimes, okay, people will get a little confused and they'll go breathy instead of going light. Breathiness is instead of changing the way our vocal folds are interacting, we're just outputting more air. We're literally just breathing out more as we talk. So literally, do that in reverse. Just breathe out less, okay? Literally less air output. So, and the sentences will last longer anyway, which is always useful. Less air output is going to help you to not be breathy. If you're really struggling with that, increase your breath output and go really extreme, and then start bringing it back. Whenever you're struggling to figure out how to do something, go to the opposite end, okay? So you can figure out how to get from the opposite end back to your normal, and then you just got to do that again to get into that desired place. Yeah, a light voice is going to be closer to Fluttershy. I don't remember how Fluttershy sounds, I'll be honest. But she probably sounds something over here. If I get really, really small, she probably sounds something over here. I don't remember how Fluttershy sounds, I'm sorry. That worked? Great. Great, 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 great. Yeah, how's everybody doing with that exercise, okay? Where it's for or like an or an versus the or Yeah? Can everybody do all of those sounds? Don't worry about this voice versus this voice, or this voice versus this voice. We'll do that later. Just focus on that buzziness for now. Yeah, do you want to give it a go while I'm muted? You can absolutely do that. Go ahead, Autobot. Yeah, just remember, obviously, it's going to be broadcasted onto YouTube, which will stay on for recording as well.
Yeah, I know. It's fine. But if you try and sound like this, that's kind of what I'm trying to go for.
Yeah, so there's what you've got there is you've got a ton of breathiness coming in. So watch that breathiness. Try to knock that back. Yeah? Literally less air output.
Like this?
Go again?
So a little more like this?
Yeah, I'm still hearing a lot of air output, but we're getting better there.
Okay, what should I try?
That was less air output. You already just fixed it there. So again, we'll go back to that baby. So imagine you're holding the baby, okay? Very cute baby. Perfect. That was perfect. Okay. Very, very nice. Now do that heavy. Baby.
I'm not sure.
So it's literally just for babies thrown up on you. Gross, baby. Yeah?
I'm honestly not sure how to do that with throwing my voice with that, so...
You're not sure how to do the heavy voice, is that?
I don't know. I think I'm just getting cold feet and I'm sweating,
Yeah, that's totally fine. If you get cold feet, don't worry about it. That's totally fine. But in your own practice, make sure you're doing both the lightweight and the heavyweight so you can listen to the difference between those two sounds. So when we want to go back and analyze, we're going to be able to hear the difference between and And we want to hear those two differences. Or Yeah, we want to compare and contrast those two.
More.
Very good, well done. Pardon?
So it's like and like that.
Yeah, kinda. I was not hearing a ton of weight in the heavy version of that. I think we could get buzzier than that. So it's not just like it's like Do you hear the buzziness in this voice right now? Or do you hear the buzziness in this voice right now? That really buzzy, heavy, like gross, baby. Why would you do that to me?
I don't know why it feels like the closer I could probably get to is like the death sound for Decepticon grunts.
I mean, the sound you're making right
now, I don't know why.
The way you're talking there, that's a perfect heavy, okay?
Like my normal tone of voice?
Yeah, probably. If you're AMAB, then you're probably going to start with a heavier voice and you're learning to lighten it. So compare your bass to you. So if we compare like this here to like this over here, okay? You can hear there's a huge difference between me talking right now and me talking right now. That heaviness is what we're trying to compare. Yeah?
So like normal like this and then a little bit like this?
Show me that lighter weight. Give me a bit more to work with.
Like, I'm not really sure, but like, I guess...
So go back to the exercise then. Yeah, there you go. That's that lightweight. So in your practice, you're going to have a play around in both of those ends. Do the lightweight, do the heavyweight, and play around with each of them. And like speak a few sentences, Okay, so now I'm over here. And now I'm just going to talk a little bit so I can get used to this sound and so I can play around with it. Or if I'm over here, and now I'm going to play around with this sound. I'm just going to talk a little bit so that I can get familiar with how this sounds and sort of get it in my brain, get that extra practice in. Okay?
Alright, I guess I practiced back when we go, hopefully.
Yep, it's all going to come down to practice. Good luck with it, though.
Alright, thank you very much for letting me speak.
Yep, that's totally fine. Thanks for speaking. Alright, fab. Another one down. So if you struggle with that one specifically, there's a whole bunch we can do. It's just going to be a matter of like finding the sound that's intuitive to you. So like we can think of like the ASMR voice, for example, versus the sports announcer voice. So like in ASMR, they'll kind of talk like this, where it's really, really gentle, okay? They're not trying to like make any harsh sounds for the listener. Versus in like a sports announcer, it's going to be like, oh my gosh, sports ball. Things to do with sports. I'm hitting the ball. Things, I don't know anything about sports. But sports announcer voice, the Wii Sports voice can be really good. Nice shot. Strike. Again, it's been ages since I played Wii Sports, but you get the idea. That sort of intense, nice throw. Those intense sort of things are going to help you with that buzziness versus not buzzy. Again, if I go over to here, okay, if I talk in this really soft kind of ASMR kind of a voice, I'm talking really, really gently right now. It's really soft. There's no big alarming sounds. Whereas if I'm over here, oh my gosh, things to do with sports. Birdie, switch sides, 15 love. Thank you, your friendly neighborhood kazoo there. That was really helpful. 15-1. Yeah, those kinds of sounds is going to really help you with your heavyweight versus your lightweight. Okay? So play with those. If you're doing all of that and you're still struggling, you just don't get it. Okay? This only helps for AMABs, I'm afraid. AFABs, you get to use this for a different thing later. If you're AMAB and you just can't seem to get it, okay? We can use the yawn voice to just plug us directly into a lightweight. So if I just give a big yawn, and I kind of talk like this, in that kind of yawny kind of a voice. I can't do that without actually end up yawning because I'm so quick to yawn, okay? But this kind of a voice is a really, really light voice, okay? So that yawny voice immediately plugs us into, it's a very deep voice, but it's a very light, a very gentle kind of a voice, okay? So if we then to just move that over to normal talking, we end up in a really gentle kind of an area, okay? Any questions about that so far? When handling weight, you can't help but change pitch when also changing weight. You can differentiate both changes by ear, but you don't really know how to actually change weight without altering your pitch. Any advice, exercise, or other factors that could help with the issue? So try staying monotonous. Try keeping the entire exercise totally monotonous. Literally, like, use a tone generator, pick a tone. So like, let's say it's like a G sharp. It's a pretty good one, G sharp 3. Just like play it, and then reproduce that, and then kind of go from here, and just make sure you're totally monotonous for the entire thing. Baby. It's going to be very weird, but baby. Oh, very cute baby. We're going to just stay totally robotic and totally, staying robotic for the whole thing. And that can help you to make sure that pitch isn't the thing that's moving. I don't mind too much if pitch and weight are moving together, partly because just like you're going to be needing. I need to pause real quick. I really need to go to the toilet. Give me 1 sec, and we'll continue as soon as I come back. Okay, that's so much better. Thank you for your patience. So, pitch and weight are kind of like a little bit tied together, in that you kind of need to go to like the absolute extremes of weight. It's easier if you're a little bit higher pitch. And if you want to be lower pitch, you have to have heavier weight. You can hear in my very light voice right now, if I just start, and this is kind of the lowest pitch that I can go. But if I was to increase that weight, I can go a lot lower. That change in your vocal weight can be tried a little bit to pitch. You should be able to move it independently. But remember, if you're trying to access a really low pitch, you'll need some heavier weight. Because you just don't have enough closure to actually produce those low pitches. But in terms of lightweight, you should be able to do that at any pitch, but it might be easier at higher pitches. The lower pitch sounded like GLaDOS. I didn't do that on purpose, but maybe. Would it be easier to start with resonance if you're better at larynx control exercises? You can start wherever you want. For most people, I find weight is a good starting point for transfem, and resonance is a good starting point for transmasc. However, it doesn't really matter that much. Go with whatever you want to go with. Yeah, Everyone get super loud as soon as the teacher goes to pee. Yep. Any other questions about vocal weight? Does everybody feel like they super duper understand it and know what they need to do to practice it? You suspect your voice doesn't actually get heavier in weight when you try to do so, because your weight is totally trained out of your voice. Do you want us to have a look at it? We can do if you want to. Obviously, keep in mind that we are live currently, so that's up to you. If you're ill, Lexi, then give your voice a break. Unfortunately, we can't really do much voice training when we're ill. You're going to be more likely to hurt yourself. It be what it be, I'm afraid.
All right, hi.
Hi, how you doing?
I'm good.
Good. Okay, so we wanted to have a little play with our vocal weight, yeah? So let's go back to that baby exercise. We're going to go,
What a cute kitty.
And then at the other end, okay, that cat just bit you, okay? It's chomping down.
Oh, you fucking cat. Oh, you
Yeah, that was pretty intense. But I heard a bit of vocal weight. Can we, instead of going into falsetto, can we like get a bit more speech so I can hear it properly?
Cat out, it hurts.
Yeah, that's perfect. That's a perfect vocal weight.
Okay, good.
Oh yeah, if you're in Trans Academy, you might want to avoid swearing. That's just for Trans Academy people. I don't really care about it. But yeah, that's just for Trans Academy's stuff because they're a PG-13 place. If you're in any of my other stuff, like not the workshop, then I don't really care. Like my stuff is not swearing free, but yeah. Okay, anybody else have any questions? Yeah, if you're in Trans Academy, they are PG-13 server. I have no idea about Trans Voice. You'd have to check the rules, I don't remember. Just go for it in your completely normal tones. Don't worry about anything other than vocal weight when you're doing a vocal weight exercise. That's the only thing you're thinking about as you're going for it. You do notice cis women have a higher weight than your own when you're training your own voice. Could you be going too light? Yeah, that's totally a thing. That's going to super... So we'll talk about this more later. But different cultures will have different expectations on how light to go. So, for example, I've heard in like a lot of Latino speakers, a lot of their cis women will have a much, much heavier weight compared to, say, in America. In America, it's going to be a much lighter weight. In England, it's a little heavier than... in England, it's a little heavier than America, but it's not like... nowhere near as much as in like Latino countries. So yeah. Yeah, if you're from any like, I don't know if it, I can't think if Spain does it as well. It might be all Spanish speaking, I don't know. But yeah, that might impact like what your expectation is. You can hear I haven't feminized my cough yet. We'll get there one day. Any other questions about vocal weight? You love my hair. Thank you. I love my hair. It just got done yesterday. This is my first time ever dyeing my hair, so... Oh, thank you. What was that about Spanish? So I'm aware that in Latino countries, vocal weight tends to be a bit heavier on average in speakers. I don't know if that's the case in Spain itself, but certainly for like the Spanish American area of the world, like Brazil and areas like that, they do tend to be a bit heavier. Any other questions about vocal weight before we move on? I'm just seeing some typing, that's why I'm waiting. Would you say your voice, Sarah, is heavy in weight? Do you aim for that? No, I'd say mine's quite light. It's going to be heavier than some speakers you hear, but certainly how I'm talking right now is pretty light. If I was to increase my weight, I kind of end up in this kind of an area. My bass talking, my like unmodified, is going to be much heavier. It's still relatively light, even compared to some cis men around me. But you can definitely hear a difference between me talking right now and me talking right now. This is a much, much lighter thing compared to this, yeah? Usually my demonstrations I'll really increase the weight so you can really, really hear it. But I don't normally talk like this. I normally talk somewhere over here. Will this workshop cover something like voices that sound childish or boyish? So if you want to sound childish, literally just take like the feminizing and go all the way to the extreme. So remember earlier I talked about the different things that create. You don't want to sound childish? It's okay. We'll still talk about it. We'll talk about it on both ends. So as air is going through and we're having all of that situation, okay? Think about the things I've described in our vocal tract, all right? Now we can also have different anatomical things that will affect that. So for example, when your voice is exposed to testosterone, you'll have your vocal folds will lengthen a bit and they're also going to get a bit thicker, okay? And also the vocal tract is going to expand, all right? What that means is it's going to be easier to go lower pitches, you're going to have more vocal weight, and you're going to have a darker resonance, okay? But we do need to remember as well that cis women also, obviously, go through puberty. They are also exposed to some testosterone, nowhere near as much as masculine cis men, but they are still exposed to some. So if you were to totally de-androgenize your voice and completely remove all of the vocal weight and have like a really as bright as it was before puberty, you're going to end up sounding like a child, okay? So you just want to increase it a little smidgen and that'll get you sounding like an adult woman, okay? Or an adult man. I mean, you'll increase it by quite a lot to become an adult man. But yeah, adult woman is going to be increased just a little bit. There's also going to be things to do with the speech style and like the way you speak. We'll cover that way at the end. So keep that in mind and we'll come back to that way at the end, okay? Yeah, if you feel like you sound too childish, consider increasing the weight just a little bit, and maybe also the resonance just a little bit, or just play around with those too. Yeah. All right, any other questions about vocal weight before we move on? I'm still getting used to hair that's like in my face. If you're sounding like a teenage boy for masculizing, you probably just need to keep going further, okay? you want to increase the amount you sound like you've been exposed to androgens. So that's going to be more increase in vocal weight and darker resonance, okay? And then the things Beth has talked about there is going to be like speech pattern stuff as well. Don't worry, Space Cadet, we'll talk about that more later, don't worry. That'll come towards the end though. When I start talking about speech pattern stuff, that's when you know. Or if I talk about like, it's the last slide. The last slide of this is going to be talking about that, okay? Before the open forum section. Okay, if there's no other vocal weight questions, then we will move forward. All right, let's go forward. So, size and resonance. This is the fun one, okay? If you're feminizing, I would say do this after your vocal weight. If you're masculizing, do it first. This isn't like super strict. And if you find that it's more intuitive to do it the other way around, then just do it the other way around. It really doesn't matter that much. But for most people, this seems to be the most intuitive order. So, resonance. Okay, I want you to listen to the difference between these two sounds, okay? I'm talking right now. I'm in that lighter vocal weight, okay? And I'm going to darken my resonance. So if I'm talking over here and then I kind of move over to here, now I'm in a much darker resonance kind of an area. I'm in that light, you might call it a more masculine area, but it's a darker kind of an area, okay? I could go really, really low and end up over here. We're still very light, but we're in that very, very dark resonance. This is as dark as I can go. At the other end, if I was to start going back bright again, this is about as bright as I can go. Okay, so this is resonance, right? If I go back over to that buzzy area and then I start darkening my resonance, I'll start ending up kind of over here, and now I'm in sort of a heavier version of my normal talking, and then I could go all the way down over to here. We'd be like super crazy resonance, okay? This is what resonance is, okay? This is your fun one. It's going to have a huge impact on the gendering. Yeah, hopefully you can hear the really big difference between this kind of a sound and this kind of a sound and this kind of a sound and this kind of a sound. Okay? Huge, huge difference there. Now what's literally happening, earlier I talked about the air going through your vocal tract. It goes through those vocal folds, chopped up, applying pitch and weight, okay? As it continues to bounce around your vocal tract, that's going to apply a resonance to it. If we want to really see this, because we see this in all different things where air is moving through like a chamber, I can go for this. Okay, so what I'm doing there, I'm muting the strings so that pitch isn't applied. Okay, I'm just tapping the body. So that's the resonance of the body of my ukulele. If I get my guitar, okay. Huge, huge difference, okay? What's happening there is literally, as the air bounces around those two different chambers, the smaller chamber is producing a brighter sound, the larger chamber is producing a darker sound, okay? That's all it is. That's all that's happening, okay? Remember earlier I said, when your vocal tract is exposed to testosterone, androgens, it increases in size. So what we're going to be doing is I'm going to teach you how to decrease that size again, or increase it if you're masculizing, so that we can mimic the effects as if we'd gone through the opposite puberty of what we went through. Okay? Does that make sense in terms of a process for everybody? So we're changing the size of our vocal tract by just moving it so that it's more in line with a typical vocal tract of the gender we're trying to present as. Hopefully that makes sense to people. I'm not seeing any questions, so we'll keep going. So, there are 3 main resonant chambers that the sound moves through. I want you to imagine that like your vocal tract is like an F shape, okay? If you like look at your keyboard, look at an F, okay? It's like an F. It goes up from the trachea into the beginning of the vocal tract, into your larynx. This is where your Adam's apple is. Through there, up into your pharynx, where it then splits to the oropharynx and out to the oral chamber, and to the nasopharynx, out through the nasal chamber, and then just out into the world. Okay? So we call that R1 for that first resonance chamber, the larynx, the R2, where that split happens, okay? And then R3 is going to be specifically the lips, all right? Because even the lips moving can impact our resonance. Now, we don't want to really fuck with VR2 and VR3, even I saw there, sorry. We don't want to mess with VR2 and VR3 very much. The main reasoning is because we need those for talking and for expressing emotions and stuff. So like if I'm smiling all the time, that's going to be really awkward if I'm at like a funeral or something. Like, oh, it's so sad. It's so sad how that person just died. Look at that sad expression I have on my face. It's really going to mess with stuff. So we want to be able to move our resonance without messing with our face, and while we're able to like use all the words we want to use, because obviously our mouth is moving a lot as we're talking. So we're kind of restricted to that first resonant space, our larynx, okay? So if you've ever heard people talking about raising your larynx or lowering your larynx, this is what we're talking about. We're literally, that Adam's apple is going to go up for feminizing or down for masculizing. You can literally see that if I move my hair out of the way and show you my throat. Do you see my Adam's apple there? Okay? If I go over to here, back into my more masculine area, it's just dropped. Or it could go really low, and now it's dropped further, okay? See how it can go all the way up. And now I'm in my more feminine area, okay? We can really, really see this. We can even do that guitar test that I did earlier, okay? And now I'm kind of talking like this. Okay, so that is literally the movement we're going for. Now, I don't want you focusing too much on the larynx movement itself. Again, just like with vocal weight, I want you sticking to thinking about the sound. But just to give you an idea of what the mechanics actually are, that's what we're doing, okay? So if you see people referencing moving the larynx, that's what's going on, okay? Now, in terms of an actual exercise to do this with, all right, so you mentioned it earlier, we're going to do the big dog, little dog, all right? Excuse me. So, another thing to mention is whenever we are in like a whispered area, so if I'm kind of talking like this right now, I don't have any phonation going on. What that means, having no phonation literally just means there is no pitch being applied. So our vocal folds are staying open. We don't have any vocal fold closure. And remember, it has to open close for you to apply pitch and weight. So if it just stays open, then there is no weight and there is no pitch, which means all that's left is resonance, okay? So when I'm whispering, any change in the sound that you hear, if I go over to here, the only thing you can do to make this happen is changing your resonance, okay? So that change in resonance is the only way we can manipulate our whispers, all right? Now, a really good exercise we can do to really, really play with this, okay? I want you to imagine that you are a really big dog, okay? Really, really big macho dog. You're like a Labrador or like a big pit bull or something like that, okay? And you're going to pant like that really, really big dog, okay? Okay, that really, really big.
And now I'm going to be talking kind of like this. If I was to maintain that posture while I'm breathing like that, okay?
Now the other end, okay, I want you to imagine you're a really little dog, okay? And we're going to pant like that really little dog, like a little Pomeranian or a little Chihuahua or something like that, okay? And then from there, all right, so take your pant, do a long one, And then from there, turn it into a sound, okay? 1, 2, ashes to ashes. And you can hear in my voice now, I sound really, really small, okay? At the other end, if we're going for our lower resonance, okay?
1, 2, ashes to ashes. Now I sound very, very big, okay?
This is like bigger than I would normally even talk at. Normally I would talk kind of over here, okay? 1, 2, okay? Hopefully that's nice and clear. So, how's everybody doing with that big dog, little dog exercise? Do people feel like they can do it? What problems are you running into as you go for it? It's dope. Good. I'm glad it's dope. It should be dope. This is the cool bit. Jumping ahead of things maybe, but your problem is you can move the larynx like that, and you've learnt how to do it a while ago, but when you do it, it seems to add more tension than it should. So basically, you might be moving it in a wrong way. Yeah, so this is really common. People very, very often will increase their, or have some tension coming in during a resonance shift. The reasoning for this is it sounds like a very different sound. And so your brain's like, wow, that must take so much effort, okay? And so your brain is like, okay, let's add a ton of effort. And especially people that are thinking about moving their larynx and focusing on that rather than focusing on the sound. It's very common that people have a bunch of tension coming in. So the first thing is ignore what your body's doing. Just completely ignore what your body's doing. And only focus on changing the sound, okay? That verse, okay? Only change the sound, okay? Next thing, all right? If you're still getting some tension, what's basically happening is your body's like, I don't really know what to change, so I'm just kind of, instead of having that laser focused sniper precision, I'm just gonna kind of shotgun blast and tense a whole bunch of things up, okay? In those situations, we really want to make sure that you don't build an association between different things as you're trying to raise your larynx, all right? Because you only want to be raising the larynx. You don't want anything else to be firing off. So what we'll often do, different people will have the tension coming in different places. I had it in the back of my neck. The vocal teacher that taught me would screw up her face. Some people have it in their tongue, in their lips, different things where it's just firing off some random extra muscle that it doesn't need to fire off. So what you need to essentially do to break that down, and this will work even if you've built that association already, but it's better to do it if you do it to start with. If you've already built that association, you're just going to have to spend longer getting rid of it, okay? You're almost going to have to relearn it. But yes, so whatever it is that's tensing up, whether it's the back of your neck, or if it's your tongue, or if it's front of your neck, or whatever it is, try to get that thing moving while you're doing stuff, okay? So for me, it was kind of very gently rolling my neck as I move my larynx, okay? One, two, and now I'm in my really, really bright kind of an area, okay? So I'm just talking in this really bright area while I gently roll my neck. Some people might need to do it on this side instead. Whatever it is that you're finding that tension in, just try to, or if it's your jaw, even if it messes with the sound, okay? Don't worry about it. So long as you're brightening the resonance.
Yeah, if you can't end up talking like this a whole bunch. Excuse me.
If you end up having to
kind of do a whole bunch of this to try and make sure that your jaw
isn't the thing that's tensing, okay? Whatever it is you need to do. You can even find that massaging the area can help you relieve that tension. Or massaging an area. Make sure, especially if it's the front, make sure you're being very, very gentle. You're just trying to remind your body to relax that muscle, okay? Hopefully that's reasonably clear for everybody. If you can help it though, don't build the habit in the first place. You want it so that the only thing that's happening is just your Adam's apple's going up a bit. That's it. Nothing crazy. Or vice versa, your Adam's apple's going down a bit. Yep, the neck stretches, that can be really, really useful. You don't quite get it yet? So literally, wherever the tension is, like wherever it's happening, try to get that muscle moving so that it can't be tensed. Because like if you're moving things around, they can't tense up because you need to move. Okay? You feel like it's the area where the larynx is. Weird. Like it's there. Like right there. You could try doing something like this. Or we could even try it like very gently massaging the area. If you look up on YouTube, there is a specific larynx massage that you can do. Have a little play with that. Just make sure whenever you're doing anything where you're touching the front here, do it very gently, okay? Because like that's your vocal tract. You don't want to like hurt yourself. You have TMJ? I have no idea what that is. Sorry. Another thing, actually, and this might help you, friendly neighborhood kazoo. When you're doing your pant, okay, try to make your pant quieter. So I don't want, because that's going to have a ton of tension when you come into this, okay? Just a nice and gentle. Make sure you can hear it, so you can hear the change in sound, but you don't need to be super loud. It's totally fine. As long as it's loud enough for you to hear it, then that's fine. And then go into your phonation, okay? Into your speech test. Oh, the exercises are similar. It's a jaw pain thing. Fair enough. Well, you can do it at the same time. Just make sure that you're listening for the right change in sound. You're struggling with vocal weight. We've just done the vocal weight bit. I'm so sorry, you've just missed it. If there's a specific thing that you're struggling with, though, then you can let me know. Generally, we're going for that or versus the for like baby exercise. The part of the head where the neck connects to the head. How do you relax that part? Do you mean here? There. If you mean there, then try very gently giving it a little massage and see if you can start to massage that tension away. And you can do your big dog, little dog as you're massaging it to try and remove that tension, okay? Sorry if I missed that earlier, further up. You've been training since August 23, but you still can't get the weight down? Yep. So it sounds like you've literally just missed the bit. If you go over to the YouTube, youtube.com/@transnetwork-12, I'm live streaming there right now. If you just rewind it back to the weight section and do that on like 1.25 speed, so you'll end up catching up to us, then I'll go through the whole weight bit just there. You've just missed it. I'm so sorry. Or stick around right at the end. I have the open forum bit where I can do some one-on-one stuff. So if you just wanted to wait till the end, then I can go over you specifically. Yeah, you're very welcome. Sorry you missed that bit. Any other questions about resonance? This is probably the most complex bit, so... Is this hard to get right? Getting from that part to relax? Yep, it's going to be really hard, especially if you've built that habit of increasing the tension. It's going to be really, really hard to strip it away. You also might find as soon as you remove it, it pops up somewhere else. So this stops tensing, and then like the back of your neck starts tensing, or something like that. It can move, so it can be really, really annoying to try and get rid of it. Small dog, little dog. Oh, you just joined? Okay, well, you're lucky because we're still in this section. So the small dog, the big dog, little dog is going to be... You're going to pant like a big dog for a darker resonance. Pant like a little dog for a brighter resonance, okay? So if you're trying to feminize, you're going for that brighter area. So start on your big dog, then to the little, and then from there, go into talking. 1, 2, and now I'm in my really, really bright kind of an area, okay? So yeah, have a little play with that. Another thing we can try is, I keep meaning to write it down here, and I totally forget every single time. But we can also do essentially the same thing, but with different vowels. So we can do like an ah kind of a sound. Brightening that resonance, or an O. Or if you're going the other way, on like I don't know, like an E. Okay, practice all of those vowels, but make sure, I didn't do it there, but make sure at the end of all of them, you do a phonation test. So,
echoing in the end of
yeah, do a phonation test at the end, do a speaking test. Ashes to ashes. Just so we make sure we are creating the right sound. Hard to do for you when you when you try to go high, your voice starts becoming silent, like a whisper. It might be an issue of weight, I'm not sure. So if you're in that whispered space, if you're whispering like this, then there's going to be no pitch coming into it, and there's going to be no weight coming into it. Okay, I mentioned earlier, to create pitch, your vocal folds open and close, and create weight, they open and close, all right? But if you're whispering, they're just staying open the whole time. So there is no pitch, there is no weight. So we can use that to play with our resonance. So is entirely a resonance change. Bye, Sifrin, thanks for coming. Also, for those that don't know, Sifrin also hosts workshops. They go into some like more specific things. Like they go one thing at a time. They'll have like, Sifrin, remind me correctly, you have like a weight workshop or like a resonance workshop where you'll go like one thing at a time. And that's Mondays through till Thursdays. And they share that with Lexi. So sometimes Sifrin will be hosting, sometimes Lexi will be hosting. That's over in Trans Academy. Oh, Sifrin's already gone. Well, if you hear people mentioning amateur stuff, then Sifrin's one of your amateurs like me. Any other questions about resonance? And this is going to be very sad that I've already run out of water. I might message my boyfriend to get me more. How do you hear resonance in your own voice and other people's voices? I find it hard to tell apart from pitch. So play around with it. First of all, in your own voice, okay? If you're trying to play with resonance, stay monotonous so that you know that it's not pitch, okay? So if I'm doing a resonance exercise, you hear every time I did the phonation, I kept the pitch the same. Ashes to ashes, and I'm going to completely keep this monotonous. Even if I then go to try and practice for
lower resonance, I'll just keep it completely monotonous so that I know the only thing that's
moving as I do this is the resonance. Keeping it monotonous can make sure that it's only the resonance. In terms of hearing in other people's voices, make sure you get familiar in your voice and then you can bring that out to other people's. That's just like an ear training thing. Yeah, practice and ear training is going to be a best thing there. So practice going without your pitch moving at all. And then for that pitch movement without your resonance changing. Yeah? For you, your voice starts becoming switchy, like on off if your resonance is too high. Oh, like your like voice starts to like cut out and stuff. That sounds like it's a tension thing. It's like I was saying earlier, try to get rid of that tension. Resonance sounds like sound wave, and Gladys, I have no idea. Resonance sounds like this. That's a resonance movement. So if that sounds like sound wave, then yes. I don't know what sound wave is. You find your own larynx moving when mine does. Yeah, that might happen. Because you're like plugging into what I'm doing. Yeah, it's cutting out. You've probably got a tension thing there. I would need to like listen to your voice one-on-one to help you with that. But go through the tension things we've talked about. You can even just try the and kind of get yourself like this, okay? Or and then get yourself over here so you're nice and relaxed, so that you can then do your and now you're kind of talking in the same relaxed kind of a way that you were just doing that. Yeah. Try and keep everything really, really relaxed. Okay, and I'm definitely going to text my boyfriend right now to ask him to get me some more water. Hopefully none of that came onto your screen. But... Okay. Yeah, any other questions about resonance before we move onwards? Oh, that question there. Better question is, how can you recognise your resonance is dropping during everyday speech without constantly trying to raise the larynx to the point it's tensing and without trying to feel the larynx to tell if it's high enough? Yeah, so it's just going to be a matter of ear training, okay? You need to go, you can absolutely rewatch a stream. Watch it on the YouTube. It'll stay there forever. So you can rewatch that. There's also like a few other ones that we've done in the past. Eventually, I'll upload the ones that are older than that. We've only just switched to YouTube. But yeah, absolutely rewatch those on the YouTubes. Yeah, so ear train. Let me grab you. Is it slash? Yeah. Let me just grab your link real quick. Okay. If you use that link there to go to the Celine archive, she has a huge archive of just clips where she'll manipulate just resonance or just weight, different things like that. So look in the size section. People will call it size or resonance. Size, they're just talking about the vocal tract size. Okay? Go over to there, listen to the clips, and train your ear off of those. 404 error. You what now? Oh, do you just need to get rid of the S on the... Oh, it might be down right now. Okay, temporarily that might be down. You can... Hang on, I've got a mirror. Okay, it's also all on YouTube, so try that one if the GitHub isn't working. Works for you? I don't know what is going on there then. They're both the same. But yeah, use that and you can ear train off of that. Yeah, no worries. Have a lovely day, Rose. Thank you for coming. If you are in Trans Network, our Discord, then you can use /Celine Clips to always get that link. How do you apply that to ear training? To your own voice. So ear training is so that you can build an understanding of what that sounds like. Okay? Training your own voice is training how to do it. They're two separate skills. Okay? Ear training is useful so that you know that you're hearing the right thing. Doing it is useful so that you're doing it and knowing how to do it. Okay, so the ear training in terms of applying to your own voice is listening to your own voice as you're talking and listening for that resonance dropping. All right? And getting that understanding of what it sounds like when the resonance drops versus when the pitch drops. Okay? You might find early on they move together. You want to dissociate them. Okay, great. Any other resonance questions? Again, if you're thinking it, somebody else is thinking it too, so make sure you ask. Are there any more resonance exercises that you recommend? So yeah, we have our big dog, little dog. We have our vowels. They're going to be the main two. If you are specifically masculizing, you get one extra cheat one, okay? That's that yawn voice we talked about earlier. I mentioned earlier, yawn voice, it plugs you straight into a darker and a lighter voice, okay? So if you do a big yawn,
and then I kind of talk like this. This has brought me straight in to a very, very dark and very, very light area. So for those that are masculizing, you can use this to bring yourself into that darker area, okay?
If you're feminizing, stick with your things that are in that whisper spectrum. Whenever we're whispering, the only thing we're changing is resonance. The only way we can change the sound of a whisper is by changing resonance. So brighten and darken the whisper and then bring it into phonation. Okay? All of your resonance exercises there are going to be variations upon that. You've heard that manipulating the oropharyngeal closure is a key to getting the highest resonance possible, the brightest resonance possible. How do you reliably do that? Okay, so that's going a little bit further. I don't often go into OPC with people because it only gets us like the absolute brightest, and for most people, you're not after the absolute brightest. However, if it is something that you're after, can I remember how I train OPC? If we go for like okay. So I'm trying to decide how I want to do this. Okay, first of all, we can show you what OPC is. So I mentioned earlier the oropharynx going to oral cavity. That's what we're talking about. If I get you a little... If I get you the GIF. Boop. Okay, that GIF there is OPC in action. Okay? When she brings those walls in, that's closed. When it's out, that's open. Okay? I will pop this into the others as well. Oh, that's not what I wanted at all. Okay, that is OPC in action. All right? Now, doing your big dog, little dog will get you doing a little bit of that, okay? To go past that, part of it is just open your mouth, look in a mirror, watch for that opening and closing, okay? Another thing you can do if you're really trying to plug into it is, I'm not very clued in on the OPC stuff because I don't tend to teach it very often. But if you try to like go like a, or in fact, no, here's what we'll do. Darth Vader voice, okay? That Darth Vader voice is a ton of OPC, okay? You might need to bring it out again a bit to bring yourself back into talking, but like, and if I'm kind of talking like this, I'm now like in a really, really bright kind of an area. This is like so bright that like I would never normally talk in this kind of a brightness. But this is like really, 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 really bright. Okay? This is how we access if we're going for like if you're going for like an anime child or something, super high amounts of OPC is how we get there. I don't recommend this for most people, or at the very least, make sure that you have the larynx stuff before you do the OPC stuff. That's going to be important. And if you're masculizing, don't worry about it at all. But yeah, for most people, you're probably not going to be after this. This is just how we get crazy amounts of brightness. And even this, you're going to get this out of Big Dog, Little Dog. You're trying to get the widest possible vocal range, which is humanly possible. No, that's fair enough. That's fair enough. Yeah, literally look at that GIF and reproduce that GIF. Normally though, your tongue's going to be higher when you're doing that. Should you replace your habit of frantically keeping your larynx up there with listening to your own voice for resonance drops? Absolutely yes. And upping it when it happens? Yes. Ignore what your body does. Focus on what the sound does. This is for all of the voice stuff. Focus on the sound. Ignore your body. Okay? Your body will just do its thing automatically. When I pick this up, okay, when I take a swig out of it, I'm not thinking about what my muscles are doing. I'm not thinking about all these different tendons in my fingers and stuff. I just go pick bottle up, move bottle from hand to hand. I'm not thinking about the tendons or the muscles or anything, what my biceps are doing, what triceps, none of it. Okay, I'm just focusing on the action. Okay, so when it's a sound thing, focus on the sound. All right, don't worry about the rest of it. Often that's where tension gets introduced. Does that answer that question, your friendly neighbourhood Kazoo? I'm just going to call you Kazoo. I hope that's okay. How do you know when your resonance is getting higher? Don't worry about feeling for a change, like I just said. Listen for the sound difference, okay? If you can hear the difference between this
and this, okay? Me talking right now is a really, really dark resonance.
Me talking right now is a really bright resonance. Okay? Listen for that sound. With reference to the oropharynx, you don't think you've had these parts going in lately? Don't worry about it too much. If you're new to resonance changes, ignore the OPC stuff for now. It'll probably come on its own anyway. Is that what gives you gremlin voice? I don't know what gremlin voice is, so I don't know. How do you feel your resonance? Don't feel your resonance. Listen to your resonance. Yeah, it's crazy that they're the same pitch, but they are, okay? This
and this is both the
same pitch, okay? I'm not
moving my pitch at all.
Okay? But if I move my pitch and I can go over here, okay, I can try and go like really, really bright and start reducing my pitch a bunch. And like, I'm going to have a little bit of change in fluorescence, but like, you can really hear how I'm still sounding really, really bright while being like at a lower pitch, okay? Yeah? If you can make like a melody out of it, okay? Or like, if I want to really, really like... that pitch, okay? that resonance. Okay? A really good exercise is literally just going and stay completely monotonous. You can even use like a pitch generator or a tone generator to like watch your pitch, like, you know, play a pitch and like listen it back and, you know, match that pitch, and just stay totally monotonous while moving for resonance. Okay. Okay. If you can do that, you've got resonance down. Okay, let me go back through some of these. For the OPC stuff, remind me at the end and I will link you a really good workshop that's all about OPC. I don't try to spend too much time on it because I feel like it's a bit too advanced for most people and I don't want people playing with that. But remind me at the end and I will link you a really, really good set of workshops. It's like 8 hours on just OPC. It's like 4 workshops, so. Okay, it still doesn't fully answer the question how to stay bright. You know how to move the larynx. You somehow learnt it through many months of training. But to focus only on the sound, you still need to move the larynx, which is moving the muscle in the way you know. Yeah, so it's like, how do I want to word this? Like the larynx is still going to be moving, and that's still what's happening. I just don't want you to be thinking about that. Listen to the sound, and listen to that change in sound. And like when you're trying to do something, the thing you're trying to do is change the sound, okay? So when you're listening to your own voice, listen for that change in sound between this sound
and this sound, okay? You can hear it in my
my voice, which means you can hear it in your voice. Yeah? And this is why, odds are, Kazoo, this is probably where tension came in for you. So try to like almost relearn resonance, but just focusing on the sound, okay? Because if we only focus on the sound, we're way less likely to have tension coming in. You're trying to change your around. Let me try that again. You're trying to change around your resonance, but it feels like you're stuck to one voice. Is that normal to feel? If so, how do you source the problem? That could mean a ton of different things. I imagine you're just very in the same kind of pitch. That's totally fine to start off with. First, make sure you're able to go and you're fully able to manipulate your resonance. Then bring pitch back into the equation, okay? You also feel sometimes when you go bright, your voice gets cartoony. Very good thing to point out there. I'm going to come back to that in the next slide, okay? Because that's a different thing that's happening. That's a fullness issue. Feels like when you try to change any aspect or multiple at once, you end up sounding like you have like a voice. Yeah, let me save those questions for the next slide because I think it could also be this next thing. It's always become hard when putting voice into it. You feel your voice is just underused maybe. If your voice is literally underused, like if you just don't talk very much, like in your normal life, it's possible that you might be a vocal underdoer. If you are a vocal underdoer, what's happened is your vocal folds have literally, like the muscles, have atrophied and gotten weaker. You are the only case where we are trying to build some muscle. And what that's basically going to be is doing those warm-ups we did earlier, those softies, and we're going to use that to build that muscle back up. This is something that I would recommend speaking to a professional about, whether that's a professional vocal coach or like your doctor or something, and speaking to like an SLP to make sure you're doing that in a really good way. But yeah, it's a matter of rebuilding that muscle so you're at a stage where you can talk like most people can talk. Like if you struggle to just continually talk for like half an hour, you're probably a vocal underdoer. Or if you only talk for like short amounts in a day, you might be a vocal underdoer. Can you get on mic for a question? Absolutely, go for it. Go for it, Kazoo. Sorry, I know I'm like catching up through chat, but yeah, Kazoo, what's your question?
Wait, shouldn't I do this in the one-on-one section, maybe?
Sorry, say that again.
Wait, shouldn't I do this in the one-on-one section, maybe?
If it's a specific resonance question, then you can ask it now.
Alright, so it's
by the way,
connected to
would
all
I
the
be
questions.
Oh, hang on. One at a time. One at a time. One at a time.
We'll talk.
Hang on. One at a time. We'll go Kazoo first, and then I'll go to the next
Yep.
person. Okay, Kazoo.
Right. Okay, so, let me try to formulate this well, because I've been saying it in a bunch of ways, and you've asked many aspects of, you've answered many aspects of it, but,
Okay.
so, let me think, so the way I'm speaking now, right,
Mhm.
it feels kind of tense, like I said, it's a bad habit, and, every time I speak, it feels like I'm pushing too much, and, I don't even know if this sound is what my bright voice is supposed to sound like, or if there are, like, other elements to it, like cartooniness, like I said, so there are multiple things wrong here. There's, like, too much tension when I'm speaking, like, it feels like I'm pushing too high, almost, like,
Yeah.
I'm
Okay.
kind of nearly choking myself.
Right.
And
Okay.
also-
Sure.
Mhm.
So,
And
okay.
also,
What you're describing right now sounds to me like something called false vocal fold constriction. So we have kind of two sets of vocal folds. Not really. We have our true vocal folds, and then just above those, we've got another set of folds that kind of look like vocal folds. They're there for like protection. So if we're trying to like protect the vocal folds, we'll close the false vocal folds to just add that extra barrier. Give me 1 second. Oh, thank you so much. It's so much better. Okay, yeah. So our false vocal folds will sometimes come in to protect things. But what sometimes happens is when humans try to put a lot of effort into something, they will close up their false vocal folds. I don't know why. It's just a thing we do. So if you imagine like lifting a heavy weight, this is a ton of false vocal fold constriction that you're hearing right now. I'm really, really pushing right now. Okay, that's false vocal fold constriction. You're not like that insane, but I am definitely hearing quite a bit of false vocal fold constriction in your voice. So the first thing is being aware of it, so that you can start knocking it back again. If you're struggling to knock it back, try. I did those sighs earlier with, I think, somebody else. Do you remember them? They can be really, really helpful for this. So I want you to do, and try to literally, don't just do the sound, do like an entire body movement, okay? I want you to go like, and really just melt. Yeah? Really big sigh. Once more. Okay, really stretch it out, really relax it.
without using bright resonance?
Pardon?
Without using bright resonance?
In whatever resonance is comfortable. Just really relax. Yeah? And now from that really relaxed posture, okay, then go back into your resonance, okay? And now I'm in that really, really bright resonance while being really relaxed, okay? How does that feel?
it still feels, well, it feels less constricted, I guess.
Okay, practice that. Play around with that sigh. Okay, we can go like. Make sure we go super fully relaxed with that. And we can even go the other way. Okay, make sure everything's staying really, really relaxed. So when we bring it into that brighter area, we end up keeping that relaxed posture. Okay? We can also try just make the brighter area easier for us. Reduce the pitch a bit. So instead of being all the way up here, we can kind of drop it down to over here or something like that. And you can use like a tone generator to help you there. Go down to like an F sharp 3, I think is the right one.
F sharp 3. Give me a second to get that.
To be honest, I'm hearing a relatively dark pitch in your voice, so I don't think this is specifically going to be the thing for you, but for some people it might be.
For me? Do you mean me?
I'm saying for some people it might be. I'm not hearing it super high pitch all the time with yours, so I don't necessarily think it's a pitch issue, but some people that pitch will increase that tension, so...
Which did you say? F sharp? F sharp 2?
F sharp 3.
I seem to only have E3.
Oh, what? How does E3 sound?
Oh, wait, I found it. Wait, that's F sharp 2.
Hang on, let me double check that I've actually got that right.
I found it.
I might have literally gotten that wrong. Let me just double check it. I don't play around with pitch very often, so... Okay, tone. F sharp 3 sounds like this. Or if that's too high, drop it down a bit. F3 or E3. You should definitely be able to get to E3. I think I spend most of my time around E3.
Wait, where is it like this? Where did it... There it is. I'll just do A3. A3 is comfortable for me.
Yeah, whatever's comfortable. The point is, try to make sure the pitch is in a comfortable place when we're doing these resonance exercises. Yeah?
Right.
How does that feel in terms of attention? Does that do anything to it?
Yeah, it sort of feels less tense also because I'm trying to make it not as tense anymore.
Okay, good. Even just doing that is probably going to help. So I think your homework, okay, is going to be just play with this tension stuff, okay? Try to reduce that tension using just sticking around a lower pitch, make it easier on yourself. Keeping the pitch nice and comfortable, and also doing those sighs, and just keep doing that and keep ebbing away until we get rid of that tension. Okay?
And stay at that brightness without,
Start off, so get rid of the tension first, and then from our relaxed state, bring the resonance shift in. Okay?
Okay.
And if the tension comes, stop, go back, get rid of the tension, and then bring back the resonance. Yeah?
Alright, thank you.
Alright, take it slow, and I'm sure you'll get there. Alright, any other questions about resonance? Are you able to ask questions in BC? I don't know what BC is. Is that... Oh, VC? Yeah, absolutely. Yeah, it can be in VC. Tell you what though, everybody prepare their questions and then I need to go back to the toilet. I'm so sorry. Spirit and Lactone's a bitch, okay?
So am I able to
Okay, I'm back. Who is it that have a question? Oh, thank you for that tone generator website. Even I didn't have one of those. I'm going to steal that really quick. Yeah, who had the question?
Me. I had like question about like resonance in general.
Absolutely, go for it.
When, the issue with my voice I have, where like when I try to do higher resonance, like you know, like the big dog, like little dog, and you try to like play the note. Whenever I try to do it, it kind of like my voice just kind of like cuts out. Like I try to do like a. It kind of gets like very wispy, and I'm trying to like get my voice higher.
Real quick, I need you to change your settings in Discord. Okay, so over next to the disconnect button, there's noise suppression. Okay, it should have a line through it. You should have your noise suppression turned off. This is just because I won't be able to hear the big dog, little dog. And then in your user settings, look on.
Noise set. I like the noise setting. Suppression. It says crisp.
Yeah, so where there's like a little ticky box, turn it off. I want no noise suppression. And then in the voice and video section of your settings, there'll be input sensitivity. Make sure that's set all the way to the left. You might have to untick it so that it's on manual instead of being on automatic. And for anybody that has questions, especially resonance questions, make sure you do that. Because otherwise I'm not going to be able to hear you. Because Discord by default will try to get rid of those quieter sounds. I need to be able to hear them.
Yeah, because when I try to do like resonance, like my voice cuts out. It's like I try to go like do the old dog and play like.
Yeah. Okay. Do you hear that?
It's good.
You're having a ton of well, you're going too hard. Okay. So try to literally quieten those pants. Don't go so crazy with them, all right? So instead of going, just go, and then bring that into that brighter voice. 1, 2. Better. Yeah? I'm still hearing some waviness, but that's okay. This is brand new to you, okay? So just, yeah, that's sounding good. All right, keep practicing, and you're gonna get a hold of that. I can already hear though. You're getting to a really good area.
Yeah, but when I kind of do like resonance or just voice training in general, and like I'm kind of stuck to this voice. It feels like I'm stuck to this voice, and I don't know how to like change it around to more like a general different fem voice or something.
Yeah, okay, so firstly, a couple of things I'm hearing there. The resonance occasionally drops a little bit, so watch for that, okay? Listen and watch for that. And then in terms of going for like different kinds of fem voices, hold fast, I'm going to go for that in 2 slides' time. Okay? All right. Any other questions, people? I'm happy to deal with your chaotic mind, Kazu. That's totally fine. Another useful thing. Thank you there, Kazu. I will have a look at that later. Any other questions to do with resonance? And if there's a question I've missed, please do just like do like a reply to it and be like, hey, you missed this. Oh, you remembered a question? Oh, we're going through all of voice feminization, masculinization. Right now we're on resonance. Might be for the 101. Okay, by all means hold it for the 101 then. Oh, someone asked earlier how long the 101 will be. So we've got like 3 more slides and then it's 101 section. Or like 4 more slides, I suppose. There's a quality in your voice you can't seem to get rid of. Yep, we'll go over that in the 101 section, don't worry. Okay, if there's no further questions on resonance, we'll do a quick recap. So, in terms of the path of vocal feminization and masculinization, Earlier, we talked about the softies. So if you're brand new, just stick with your softies. Do those for like a week or so. Make sure you're doing those like 3, 4, 5 times a day. Okay? From there, if you're masculizing, start with resonance. If you're feminizing, start with weight. Okay? And then afterwards, swap. Okay? You're ready to swap once you've mastered the thing you're doing. Now, it's not super important which way around you do those. You know, if you really want to, start resonance first or whatever. If one of them's more intuitive, by all means, start with that one. But for most people, it's going to be more intuitive. Feminizers with weight, masculizers with size. It also means that for the first thing, you have that yawn voice, so that you can cheat if you need to. Do those, get really good at those, and then swap. All right? So you've mastered weight, go over to resonance, or vice versa. Okay? In terms of your practice, things I really, really want, all right? I want often, I don't care how long for. All right? If you're doing 4 or 5 exercises a day that are all like 30 seconds long, great. If you're doing 1 practice a day that's like an hour long, that sucks. I ain't gonna cut it, I'm afraid. We're trying to learn like new muscle memories. Muscle memory comes from frequency, like how many times you're doing it, not how long you're doing it for. Okay? So make sure we're doing it. I mean, a minute practice is always better than a 30 seconds practice, but 2 practices is always better, even more better than 1 practice, even if that 1 practice was longer. Hopefully that makes sense. So I really, really want you to be focusing on often, not huge periods of time. Those longer practices, they can be like we can spend a long time learning a new thing, and if we're exploring and we're learning stuff, that might take longer, but revising and practicing on things we've already done, like just going over exercises and stuff, that's going to be a shorter thing. Yeah, no, an hour a day is going to be rubbish and it's going to be hard to keep to. I would so much rather you do like 4 or 5 practices, even if they're just like 30 seconds. Try and get like a minute or 2 ones in there. But yeah, we really, really want often, and how long it's for doesn't matter as much. Okay? Another really useful thing with practice, okay? The drills and the exercises we've gone through are great, but they're not talking, okay? Make sure anything you're doing, try to make sure within your practices you have some just normal talking. Like using that thing you're learning. So if you're learning weight, for example, you're trying to like lighten your weight. Talk for a little while in that lighter weight, okay? You can like, I don't know, describe the day you're going to have, like your plans for the day. Or if it's the end of the day, describe what you've done in the day in like a Dear Diary kind of a way. Or explain something that's kind of complex to yourself. Explain how you're doing, explain vocal weight to yourself. Or, I don't know, if you know about programming, like explain something to do with variables or whatever. Something where you're having to think and talk at the same time. So you have that extra cognitive load that you have to think about. All right? That's going to be really, really useful. Whatever it is you're doing, you need to practice just talking in that kind of a mode. All right? Hopefully that makes sense. I'm just looking through questions right now, so I'm doing. Okie dokie. So, moving forward. All right. So a few people mentioned their voice sounding cartoony. All right. This is going to be the section to address that. So, we mentioned vocal weight. We mentioned vocal resonance earlier. Those 2 things kind of interact with each other. Neither of them individually make the gendering of your voice. It's the interaction of the 2 that makes the gendering of your voice.
So if I'm kind of talking like over here, I reduce that vocal weight, but I don't sound any more feminine by doing this.
Or if I if I go over here and then I kind of go over here, I haven't really made it like really feminine by doing this. I just kind of sound like annoying and weird. Okay? What we're going for is a balance between our vocal weight and our vocal resonance. This is called fullness. All right? So lightweight plus a bright resonance makes for a full sounding voice. And that fullness is going to go all the way from full fem to full masc. Okay? So long as that weight and that resonance are in line with one another, like in this graph, okay? Sometimes you guys can see my mouse and sometimes you can't. I don't know what impacts that. But if I draw a line from from fem to masc, okay, that's our fullness line. All right. So like you can imagine, there's our x-axis, there's our y. That line, that's our fullness line. Okay. So if I kind of go over here and then I just kind of increase the weight, it just kind of sounds weird. But if I then start decreasing the increasing the size, then I end up sounding full masc. Yeah? Does that make sense, everybody? So that weight being proportional to the size is going to make it sound more, quote unquote, normal. So if you're sounding cartoonish, you're probably in that overfull or in that hollow section. What does it mean by overfull? So if we're overfull, okay, then our weight, we have too much vocal weight for the resonance we're using. Or we have too bright of a resonance for the weight that we're using. Yeah? So we need to darken that resonance, or we need to shed some of that weight, depending on what we're targeting. Even if you're targeting to like androgynous, you want kind of middle-ish weight and middle-ish resonance. They want to be in proportion of one another. Yeah? Now, this isn't like a perfect through line. That perfect in the middle is one kind of a voice, but we can move closer towards one end or the other. As long as we kind of stay within this quadrant, we can be moving closer to hollow without necessarily sounding fully hollow, or we can be moving closer to overfull without completely just sounding overfull, but we want to be within this quadrant, okay? So like a slightly more hollow voice while still sounding femme is going to be like Celine De Silva from Online Vocal Coach. She sounds a little bit more over here, okay? Or for like an overfull, if we're going for that Latino thing I was talking about earlier, with a slightly more vocal weight, that's going to be a bit closer to overfull, but still definitely within this quadrant. All right? What happens if you're dead center of a chart? Then you're going to have a very full androgynous voice. That's like the perfect androgynous voice, which most people will struggle to achieve. Usually you're going to be somewhere within one of these quadrants, just because it's hard for our brains to conceive of a completely genderless voice. How does that sound? I'm not going to be able to get dead center, but if I start kind of reducing my resonance a little bit, and if I start increasing the vocal weight just a little bit, this kind of sounds a little bit over in the middle of it. It's not quite perfect because I don't tend to be, I'm not trying to present androgynous. But yeah, so it's going to be kind of somewhere over here-ish. Yeah. Even though I'm probably going a bit too light, so I need to go a little bit heavier and be kind of like over here-ish. And that's going to be kind of like an androgynous kind of a thing going on. But it's really difficult to get perfect, like perfectly in the middle of that chart. Because like people don't typically talk like that. So you don't really have much to go off. Arfane, thank you so much for coming. See you next time. Miriam has to go as well. Well, thank you so much for coming, Miriam. I'll see you next time. And you're very, very welcome. How does the chart work? So, I mentioned that fullness line. So that is what we're targeting, okay? That balance between weight and size, both from being in proportion, all right? We have our weight axis. We have our resonance axis. That's small and large, that's your resonance, okay? Your vocal tract size being small and large. Yeah? Now, this graph can be really, you don't have to apologize, that's totally fine. This graph can be really useful for like a little practice thing, okay? What we can do is, let's say if we're AMAB, we'll start over in our masculine full kind of an area. So we've got our darker resonance, we've got our heavier vocal weight, and we'll just draw a shape. So let's say we'll draw like the letter C, but we'll go from the bottom, okay? So I'll kind of go from here,
I'll go over towards this hollow kind of an area.
I'll then kind of brighten it up over to here, and then we'll move over into our overfull kind of an area. So this can be a really useful thing if you're trying to just gain like mastery over your voice. Just draw like drawings on this, okay? And then follow that line as you go through the chart. Does that make sense? So that can be really, if you're like trying to get to that advanced level, play around with this fullness chart. And just target whatever different coordinate within this. Yeah, good, good. You can't see the mouse. Ugh, I hate that you can't see the mouse. You get the idea of what I'm talking about though. That sort of, start from one place, draw whatever shape you want to draw, and just follow that line with your voice. And move around and see what happens. And see how well you can keep to your line as well, in terms of within your own voice. Yeah, so like, I don't know, what's a shape? Like we could just do like a square. So let's say I'm starting in mask 4. I could be over here, and then I could move over to hollow, and then I could bring it up into full fem, and then I could bring it over into overfull, and then I can bring it over to mask 4 again. Yeah? Just draw a shape and play around. Play with the graph. That's exploration. Yeah? Explore the different sounds that are made by going into different parts of this graph. And you'll notice, all right, because you mentioned something there, you'll notice some like voices, okay? Try listening to other voices and plotting them on this graph, okay? You'll notice that SpongeBob kind of is in this overfull kind of an area.
Or if you go over to Patrick is in this kind of hollow kind of an area. Or like a Yogi Bear, I'm smarter than the average bear. He's got a very hollow voice. If I just go breathy, this is kind of like Pooh Bear. Oh, Christopher Rob.
I don't actually do those voices very well, but you get the idea. Yeah, in this overfull or hollow, if we're very far away from fullness, that's when we're going to start sounding cartoony. You'll literally find that a lot of cartoon characters are somewhere either overfull or hollow. This is them trying to like put them really far away from the norm to like dramatize their voice. Question about practice. Would it be good to space out for practices? Yes, it would. At what point do you start incorporating your voice into your daily speech? As soon as you're willing. If you can, like whatever you're practicing, if you can bring it into just daily speech, you're going to benefit massively. The sooner we're going into daily speech, the better. And the more time we spend in, even if you've only learned one thing so far, even if you've like just started weight, okay? If you're down, use it all the time. You're going to learn so much if you just exist in that space. Yeah? Ahimi, yeah, if you're brand new to this, then plotting yourself on this graph is going to be difficult. I would recommend doing the ear training I mentioned earlier. So do that ear training because they'll tell you where they are on this graph. Like listen to an overfull voice. Listen to what it sounds like. So me talking right now, this is me talking overfull, okay? And if I then move it over to full fem, this is me talking in full fem.
If I move over to hollow, this is me talking in hollow.
And then if I bring that weight again, this is me talking in a full mask. Yeah? So heavy and large is full mask.
Heavy and light is hollow.
Small and light is a full fem. And small and heavy is over full. Yeah? You do know music theory. You can rate others' voices, but your own feels a bit weird. Yeah, that can be a thing. Listen to recordings of yourself. Sometimes it's a bit easier with recordings. I wish you guys could see my mouse. That's so annoying that you can't, but whatever. Yep, you're going to have to get used to your recorded voice, I'm afraid. Any songs you'd recommend singing along to? I don't know, actually. Any song should do. I suppose just one with a masculine speaker so that you're already tuned into what you're going to be hearing. And like a song that you already like know, you know? One that you're familiar with. Yeah, I can't really like draw on the graph while I'm doing the presentation, unfortunately. It's really annoying. You think you'd be hollow? Good. So that's you plotting yourself somewhere. So if you're trying to feminize, just bring yourself back up to that brightness. You're a kazoo. We're talking about resonance and weight, but what does pitch have to do with this? Brilliant, brilliant, brilliant question. Okay, so pitch isn't on this graph. That's because pitch doesn't really affect things that much, okay? If I speak at a lower pitch, I just sound like a chick speaking in a lower pitch. Or if I go over to my masculine voice right here, and then I just increase the pitch, and now I'm kind of talking over here, I just sound like a dude speaking at a higher pitch. So pitch isn't on this graph, because it just doesn't affect things that much. So don't even worry about pitch. I call pitch and I'll talk about this more in the next slide, I call it gendering 0.5, because it barely really affects stuff. Yeah, no worries, no worries. Struggling to put yourself on a graph? Yep. Do some voice training. Do some ear training. Listen to what you're doing and play with your weight. Yeah, you know if you know you're going into a lighter area, you know you're going to be in this half. If you know you're going into a bright area, you know you're going to be in this quadrant. Yeah. Okay, let's move it forward, because this bit is probably going to help some of you. So in terms of, let's imagine, all right, you have brilliantly feminized your voice, you've masculized your voice, whatever it is that you're trying to do, you're getting to the bit of that graph that you're wanting to get to. But there's a lot of different feminine voices. There's a lot of different masculine voices. So when you mentioned earlier, they asked what kind, how do they change what kind of a voice they have, all right? This is going to be some of that stuff, the customization stuff, all right? When you're in your bright resonance and lightweight, it's super hard to do that anyway. Yeah, that's practice. That's just practice. So in terms of customization for our voice, there's a million 3 different things that go into a voice that you can play with. But this is just some of the common ones, all right? Now, vocal fry is going to be, I'm not even going to go into all of these because we're going Jesus, we're already nearly at 10 to 10. So I'm going to try and race through some of this. So we still have time for the one-on-one stuff. But yeah, okay, vocal fry. This is if I start talking like this. This is vocal fry, okay? Now, a really nice thing of vocal fry is it allows us to go into lower pitches. So if you're masculizing, you can use your vocal fry to try and access lower pitches, all right? You can kind of go all the way over here. Okay, so there's vocal fry. Now, a really nice thing with vocal fry, because it gives us access to lower pitches, humans will because we have that association and that understanding intuitively, you'll hear almost like somebody struggling when they're using fry, sometimes. As a trans femme, we can take advantage of this, so we can pretend that a pitch is lower than it actually is, or that we're struggling more than we actually are. So if every time, let's say this is the floor to my pitch, okay? I can add vocal fry every time I go over here. And then it'll sound like this is my pitch floor. Because it sounds like I have to use vocal fry to get over here. So there's just like a little cheeky thing you can do. So like every time you go to a certain pitch, you just bring in that vocal fry. A little cheeky thing you can do to pretend that you were just born this way. I mean, you know, whatever. Yeah, there's a little fun little thing you can do. Some people like fry, some people don't like fry. Use it if you like it. Whatever. You'll hear that my voice, and especially as we go into like potentially the next hour, you'll hear a lot of vocal fry coming into my voice. Because as I get more tired, I tend to add a bunch of vocal fry. It's just a habit that I have. I quite like it, so I'm not doing anything about it. Yeah, you probably do have a lot of vocal fry with your deeperish voice. That'll help it. If you're wanting to go into like a deeper feminine voice, having some fry there will help it stay sounding feminine. Okay, pitch, because we had a bunch of pitch questions today. Pitch, I'm putting in this customization thing because I don't really consider it particularly gendered. You do have, on average, females tend to speak at a higher pitch than males. However, this is just on average. And if you deviate from that norm, you'll just sound like you're deviating from that norm. It won't change the gendering. So if you are going for a feminine voice with a lower pitch, that's what it will sound like. A feminine voice with a lower pitch. Or a masculine voice with a higher pitch. It won't affect the gendering. Okay? Like my voice right now is a lower pitched feminine voice. It doesn't sound like a masculine voice because of that. Yeah? And a lot of people, that's why I mentioned them first, a lot of people like the deep femme with fry. Yeah? I think I'm going to skip twang, nasality, and nodal because most people aren't interested in them. We'll just go over breathiness quickly because some people like that as well, and it can affect different areas of our previous training. Breathiness is a very simple, we just increase the breath output. That's it. So if I kind of talk like this is me going super, super breathy, okay? Now, if in one of your earlier exercises, like in the weight, you're accidentally going super breathy, okay? Play around with that breathiness. Go super breathy and then try to bring it away again. All right, and get yourself familiar with that breathiness if that's something that's accidentally coming into your voice as an artifact. Or if you just like the breathiness, then have a bit of breathiness. That's totally fine. Some people like breathiness, some people don't. Again, it's just another thing to play around with. All of these customization things, have it, don't have it. It's just up to you. You're at pick and mix now. You're choosing what kind of voice you want. The others, I want to skip forward because we're getting short on time, but you can Google them if you want to. But those top three are going to be the most popular ones. Any questions about customization stuff before we quickly move on? You need to know about time? Okay. Had a bit of beef stuck in my teeth there. Okay, vocal twang is... how would you twang again? My brain has just completely deleted twang because I was like going to skip over it. What's my twang exercise? Come on, I know this. What is my twang exercise? It's just not coming to me right now. Hang on. Oh, that's it. Baby crying. Okay. Imagine you are a baby, okay? You're going, wee, wee, okay? And then kind of talk with that twang coming in. That is your twang, okay? So if you're talking like this all the time, you've got that babyish kind of thing going on, that's vocal twang, okay? It's going to make things a little bit louder when we're in that brighter resonance, because sort of, if I understand it correctly, your tongue is kind of raised, and so as the sound goes through, it gets like compressed, which helps project it further. Okay? It comes in for Southern accent as well. If you've got like a Southern American accent, then you're going to have a bunch of twang coming in. Yeah, you know, I've never thought about it. Actually, no. Wait, what's that slug lady called in Monster Inc? I don't remember. She's nasality, I'm pretty sure. Yeah, so this is kind of more like her kind of a voice, where she's got that hypernasality, where you're totally blocked off the nose. I think this is how she talks, as opposed to kind of over here. If I kind of go for like a South American kind of thing, we get like a turn of twang coming in. Yeah? Now, we don't have to be that level extreme, but that's to practice it, and then you scale it back a little bit to bring it into more of a normal talking. You got South African English accent. I have no idea. I'm so sorry. I'm not super familiar with that accent. Yeah, I know. My Southern USA accent isn't very good. I know. But yeah, so that Texas voice has a ton of twang going on with it. Have a super heavy accent. Could it be twang that holds me back? I don't know. Maybe. I'd have to hear your voice specifically to know that. It's nothing to do with my larynx. I believe it's all just like a tongue thing. Jen, yeah, go for it.
So since I've also only got 5 minutes left until my power goes out, and yeah, I
Very
will not be
quickly.
here anymore.
Mm-hmm.
Like my power will go out in about 5 minutes, so I will not be able to stay here for longer.
Okay, that's totally fine. I'm not hearing any twang in your voice, if that was your question. Beanies, you've only got 5 minutes. Do you have like any further questions you want to really quickly ask, or anything you want me to look at?
I suppose it's just like people like for some reason can always like tell that I am like forcing my voice or something, or just they can tell that I'm born male and I'm speaking female. It's like they even sometimes say I sound like a film boy, and I am not really sure what to I am not really sure like what I think my voice is missing right now.
Okay. I'm just hearing a cis female voice right now. This doesn't sound anything unusual to me. I can't think of anything that could be like clocking anything. The people that are pointing that out, are they like nice people, or are these like not so nice people?
No, they are just like people I just see on like video games, like on like I can't speak. Wait a minute, sorry.
It's okay. Okay, what might be happening is this is like a bias thing that happens in video games. Sometimes people are kind of arseholes, and especially when they hear female speakers, they tend to be a bit more arsehole-ish, and some people will just accuse random women of being trans, and you might be they're just accusing you of being trans based off of nothing, but because you actually are, you're like, oh shit, they know I'm trans, but they're probably saying that to like 10 different cis women as well, and they don't actually know a difference because there isn't a difference in the sound, but they think they're just throwing shit out of the wall and seeing what sticks. So I would guess you're probably just getting some assholes, because to me this doesn't sound like trans. This just sounds, yeah.
So like it's not like any single thing that I should be trying to like focus on, or like to
yeah, I just hear feminine voice. Like everybody in chat, everybody right now, tell her how her voice sounds. What do you hear? Okay, look at chat.
Totally passing. There is nothing that's anything other than like cis female.
Exactly. Look in chat. Everybody is, yeah. I think you've just run into some bad apples. I don't think there's anything actually in your voice there.
But this is like every single time I like turn on my my microphone in games, I just like get the same reactions from everyone, like almost everyone.
Yeah, I'll be honest, I'm not hearing it. I have no idea what it could possibly be. My suspicion is there isn't anything, and people are just arseholes sometimes.
Alrighty.
Like if you
Understand.
speak to a bunch of cis women that play video games and do like voice stuff, like they will also, you'll like ask them, and I guarantee a whole bunch of them will be like, yeah, I've been accused of being trans, because just I don't know, some gamers are assholes. I don't know what to tell you.
I understand.
People get mad in video
Thank you.
games, and yeah.
Yeah, I understand. I just want to say that Jesus.
It's okay,
I
Dorian.
just want to say thank you.
Oh, you're very
for
welcome.
my power goes down since it's probably gonna go out in like a minute or so.
Yeah, no, sorry, that's totally fine. Yeah, you're very, very welcome. I think you are just running into shitty people. I don't think there's anything wrong with your voice.
Alrighty, thank you.
All right, no worries. Have a lovely, lovely night.
You too, and everyone else.
You love my nails. Thank you. I haven't even done anything with them. All right, have a lovely night. Okay, any other questions? Anyone want to ask about any voice customization stuff?
Also,
Wait for one, it's okay. What was that question?
Also, like so, like if you like tweak around these, like the fry, the pitch, the scale, and breathiness, like, and you like tweak them around to get more like different sounding fem voice, like a deeper sounding fem voice like yours.
Yes, if you want a deeper sounding fem voice, try a lower pitch. And you can also like add a bit of vocal fry at the bottom of stuff. And that'll often get you that deeper sounding fem voice.
I try to combine like multiple at these like at the same time, but then it just ends up kind of putting strain on my voice.
Okay, so you're probably just sort of, it's not that adding these together equals strain, it's that you're probably doing too much too fast in terms of like you thinking about it. So like try just, for example, if fry is one of the things, try fry, play with fry, get used to fry, and then add pitch. Try like whatever pitch you're going for. If that's a lower pitch, try a lower pitch, get used to that, talk like that, and just do them one step at a time.
Yeah, I think like the easiest one to do for me is like fry, because we can already do this like hey, like that.
Yeah.
But it's also just like just in general, because like it's kind of easy to me to like do the fry with like a deeper voice, because like, well, like I automatically default to having like a more heavier like weight. So when I try to bring up my weight and I still hear that fry, it just kind of demotivates me.
Yeah, sure. So just take it slowly and go one thing at a time. Remember that all of these different things, none of them are gendered. Adding vocal fry doesn't impact the gendering of your voice. Pitch doesn't affect the gendering of your voice, or much. Like barely.
Gender 0.5.
Pardon?
But yeah, so if I go like this, but like I like so I go up like this, and I like make the weight like less, well, too strainy, but then it just sounds not good. If I try to like add some fry to it or some breathiness, would that sound good? I don't think it does.
Yeah, so what's happening is your resonance is starting to drop as you do other things. So for now, for you, I would say focus on resonance. Get really good at resonance, okay? That vocal tract size stuff for larynx height. Stay there for a while, get really good at that, and then come back to this section. Yeah. That's my suggestion.
Also, what is like nodal again? Sorry if I messed it up.
Oh, nodal, or I think it's supposed to be like nerdle or something. It's a German word, I think. So nodal is kind of, if I cannot talk like this is me adding a bunch of nodality. I'm doing like a Stitch voice right now, but it's Stitch at the end of a film. Stitch at the start starts with like a ton of OPC. At the end, One is like ohana, one's family. This is nodality, okay? This is so much nodality that nobody talks like this. But if I kind of bring it back into like some normal voice, I don't use nodality very much, so I'm not very good at it. Or I'm not very good at bringing it into normal voice because it's not something I use in the slightest. It's not very common in speakers.
I guess.
Yeah, a little bit. Yeah.
Also, what OPC or something?
Oropharyngeal closure. It's a thing we talked about earlier. That GIF, if you scroll up with a woman's mouth, that's OPC. Nodality. The only voice that I've heard, like actual person that I've heard talk like this, is Jordan Peterson. So if you're doing the Jordan Peterson impression, that's going to be a bit of nodality. Or if you go to like the Muppets, like their names, Kermit the Frog. Kermit the Frog has a bunch of nodality, or like Miss Piggy, she has a bunch of nodality. Those kind of Muppety kind of voices, that's nodality.
Are the customization thingies listed in order of importance or just?
No, it's all just whatever. This is just a list of some, and there's more than this. Literally just like listen to voices you like, pick apart the things you like, and try to emulate them.
Yeah. How much of each customization does your voice use?
So I have a lower pitch, and occasionally I use bits of vocal fry. Yeah.
Okay.
All right.
Thank you.
You're very, very welcome. Any other questions? Oh, did I pin it? I can't pin it in Trans Academy, I'm afraid. If you scroll up, then you'll be able to find it.
Thank you for the advice.
You're very, very welcome. I suppose I can just put the GIF again for people that are wanting it. Boop. There you go. My dog's just ran upstairs, so if she comes into this room, then don't worry about it. Okay, any other questions about customization stuff? Otherwise we'll move forward to the last bit. She's probably just going to bed, but... we'll review that bit at the end of the one-on-one section. Remind me, Himi, when we get to that bit. We've got one more slide and then we'll go to the one-on-one bit. I don't know if you can hear her tippy-tapping in the back there. All right, well, if there's no more questions about the customization stuff... Oh, Jaxie has one. Go for it, Jaxie. What's your question?
How important are the bottom three?
How important are the bottom three? It entirely depends on the voice you're going for. All of these are equally important or unimportant. This is literally all just things you might want. The most common three are fry, pitch, and breathiness. These twang, nasality, nodal are like off the top of my head other things I could think of. It's typed O with this ... thing, like Ahimi's put there. I don't even know how to do that. But there's like an inexhaustive list of different things that can exist in a voice. This is just a selection of them. But yeah, they're all equally important / unimportant / do whatever you want. This is pick and mix. If you like it
depends.
Yeah, it depends on your goals. If you like it, use it. If you don't like it, don't use it.
Which one would be good for hollow?
Any of them. It doesn't affect any of that stuff. They're all just whatever you want.
That's all I needed.
Yep, no worries. Any other questions before we move forward? Yeah, it's like a little accent thing. ... Yeah, I think that ... infers that it's like knödel or like nerdle or something. I don't know. Is it good to relax when doing so? It's good to relax when doing everything. Everything should be relaxed that you do with your voice. Like literally everything. I pronounced it pretty well? Yeah, cool. Knödel. or nerdle or something. I don't know. It's almost like an ER kind of an E sort of vowel. What note are you supposed to aim for again? Whatever you... Oh, for your specific thing for early in the stream, that was a... Yeah, like an F sharp 3 or like an E 3 or something. Just something low enough that it's comfortable. Like just pick a comfortable pitch and use that pitch for when you're doing your resonance thing. Oh, there you go. It was A3 that person used before. How are you supposed to know what pitch you are? You're not the best of music theory. So there is an app called Pitch Tools that you can download on your phone, and that has a built-in pitch tracker if you want it. I would want you to move towards building your ear and your hearing so you can hear when you're matching pitch. But to start you off, that's totally fine. Now, a big disclaimer with all apps, and this includes Pitch Tools. It's for like Android and iOS. Like it's a mobile app on any of the mobile devices. If you're on desktop, just Google Pitch Tracker and I'm sure you'll find something. Yeah, a big disclaimer with Pitch Tools. Voice Tools. Big disclaimer with Voice Tools, okay? Was I saying Pitch Tools earlier? I meant Voice Tools. Yeah, the app is called Voice Tools, okay? Big disclaimer with it though. For all voice apps that you ever download for your phone or whatever, a lot of them will say feminine and masculine in them. I want you to completely throw that out the window. What they're referring to is just pitch. No app can analyze the masculinity or femininity of your voice. They're only looking at pitch. And you remember earlier, like just now, I've been saying how pitch is like gendered 0.5. Like it's kind of gendered, but also not really. Okay? So if you do like the analyze thing on any of those apps, just forget everything it says to do with gendering. Okay? It's just wrong. Even if you use a spectrogram's misinformation. Really, for gendering a voice, you've got to use your ears. Spectrograms don't misinform, but for example, spectrograms, if I remember rightly, they don't detect vocal weight, they just detect volume. Spectrogram is obviously a lot more information, and it'll, I believe, one of those waves within a spectrogram is resonance. But yeah, if I remember rightly, they don't detect weight. It just looks like they do. They actually detect volume. If I remember, I might have gotten them wrong around. It might be weight, not volume, but I'm pretty sure it doesn't detect weight. Also, like there's like you have to learn a lot to use a spectrogram. I don't really recommend them. Or like if you're gonna do them, like you got a lot of studying to do there. And either way, like even if you were to use them, like you're only using them as a temporary thing. Yes, there's a brilliant way to detect weight. It's your ears. Yeah? Everything with voice stuff, I really want you, don't chase numbers, don't chase a feeling in your body. Sound. It's the sound you're trying to change. So really focus on the sound, okay? Everything you want to be doing, I always want you, even if you're like temporarily using something else, bring it back to sound, okay? That's what you're trying to move, so that's what I want you to focus on. Yeah, so if you did trumpet stuff, you know about tuning, that's going to help you with your pitch stuff. Recordings are good, yeah, listen back to your recordings. Oh, where can you find this stream? YouTube.com/@transnetwork-12. and you can rewatch this entire VOD. It'll be on there forever. I'm not going to link it in Trans Academy, and I'm not going to link it in Trans Voice, just because they're not my Discord servers, and I feel like that would be inappropriate. But the link is on the screen now. It's below me. You can use that. Again, that's youtube.com/@transnetwork-12. Or you can join my Discord, which is that link there. And everything is available in my Discord. And I think that somewhere in there there'll be a link to the YouTube as well. I think on the YouTube as well there's a link to the Discord. So you can use either to get to the other. And if I'm wrong there, somebody tell me. But I'm pretty sure I'm right. I think it's in like the channel description or something. Oh, it's blurry. Okay, yeah. youtube.com/@transnetwork. Wait, my brain shut down there. youtube.com/@transnetwork-12. Yeah, that at there. youtube.com/@transnetwork-12. And then from there you should be able to get a link as well. It should all... You've seen me recommended on Meta brand. Oh, Nikki, I was going to say you haven't seen me recommended on anything. I'm not on any Meta branded stuff. Oh, you can also, if you just click on my Discord user on my profile, I'm pretty sure I have links to stuff as well. So you can literally just use that. That's the easiest way. Yeah, just click on my user and it's got all of that. What has just happened? Oh, I must have accidentally clicked on it. Lol. Okay, whatever. No, don't worry. Okay, we're going to move on to our last bit, and then we'll go over to the one-on-one bit. So, boop. All right, articulation stuff. Oh yeah, thank you. Wow, I'm at 28 subscribers. I didn't know that. Yeah, but that's me. Beth was the first. 29 now. Heck yeah. Thank you guys. But yeah, previous VODs are all going to be on there, and expect more stuff eventually. Oh, we're going to break 30. Hells yeah. All right, so articulation. All right, this is going to be our last slide. Okay, if you have gone all the way through this, but you're still finding that you're just not hitting the femininity you're wanting or the masculinity, it could be your speech pattern. All right. Some people mentioned earlier how they find themselves sounding like a teenager or sounding like a young boy, like a child or something. This could be speech pattern stuff. Okay. Now, there's a few different components to this. We're going to go a little at a time, and then I'll stitch it together in something that's going to make a lot more sense. So this is going to be really confusing, and then it's going to make total sense. All right. So the first thing we're going to look at is sharpness. Okay, this is going to be sharpness versus muddiness. All right. Now, generally, this is all of this articulation stuff. Now we're talking in huge generalities. All right. Very much take all of this with a pinch of salt, and in your locality, it may differ. Okay. This can be quite regionally influenced, and can generally just be it's broad strokes. Okay. So generally speaking, certainly at least in like a Western voice, generally a more feminine voice is going to sound sharper and a more masculine voice is going to sound duller or muddier. Okay? An exercise we can do to play with this is if I go, we're using the t sound, and we're going to go, well, we'll just do this, okay? Can you hear how the sounds a bit muddier, okay? This is going to be more of a masculine speech pattern if we're a bit muddier, okay? If I'm more of a everything's more clearly pronounced, everything's sharper, this is going to be a bit more feminine, okay? You can imagine like a hi-hat being closed. This is your feminine. Open. That's your masculine, okay? So there's one part, all right? We've also got our vowel elongation, or our vowel focus versus our consonant focus, okay? If you hear in my voice, listen to where the sounds where the focus is on all of the words, okay? You can hear that the vowels are really stretched out, okay? And the consonants are almost like skipped through, yeah? So that stretching out of the vowels is going to be a bit more feminine. That focus on the vowels of a word. Whereas if I speak more masculine, can you hear how now I'm more focused on the consonants? You hear the consonants more. I'm like sitting on those as I skip through the vowels. Yeah? Does that just alter the t sound? It'll alter the t sound. I think it alters the k sound, the d sound. A bunch of those really like sharp consonants are going to be affected by sharpness. The k, yeah. When they did it, sounded more like the flint and steel sound. What? Oh, yeah. Yes, so we can have that vowel focus or that consonant focus, depending on what we're going for. All right? And then the other thing we can have is, and there's going to be other things as well, but these are going to be the most common ones, all right, is some pitch movement stuff. Now, I mentioned earlier that pitch is like barely gendered, but the way we use our pitch is a bit more gendered. Again, this is broad generalities. Generally speaking, a more masculine voice is going to be more monotonous, and a more feminine voice is going to have more movement in that pitch. Okay? The other thing is the way we move that. I'll go into how we incorporate this into speech in a moment. Excuse me. A more masculine voice is going to have less movement in pitch. A more feminine is going to have more movement in pitch. Also, a more feminine is going to flow between those pitches, whereas a more masculine is going to jump around between them. Again, huge generalities here, and there's going to be tons of exceptions. You probably know some people that talk differently to how I'm describing. But in general, this is what's up with that. Okay? So, in terms of how to put this into practice, because this is a lot to think about all at once. For the pitch movement, the pitch is probably the easiest one for us to start modifying. So I want you to, if you're feminizing, imagine that we're kind of drawing circles, all right? And our pitch is going to go up at the apex and it's going to go down at the trough, okay? And we're just going to move our pitch up and down as we draw these circles. Now you'll also notice that I'm flowing from one pitch to the other very gently. There's just, yeah, we're flowing from one to the other, okay? For more masculine, I want you to just, like a heartbeat monitor, okay? We're going to go up and we're going to go down. And we're not really going to vary it very much, but when we do vary it, it's going to be in big jumps, okay? Now, a way to bring all of these articulation things together to make it sound even better and to make it even easier for you to think about, okay, is if we just bring all of these into like a character, okay? So for our femme speakers, try speaking like you are a kindergarten teacher or a nursery teacher and you're reading a fairy tale out to little kids, okay? So we're going to slow it down. We're going to have that pitch movement because we're keeping the kids interesting, okay? And it's a fairy tale. So we want that like impassioned kind of talking, all right? Once upon a time, in a land far away, you can hear that the vowels are really stretched out, yeah? You can hear the pitch is moving up and it's moving down because I'm really trying to add some drama into this story because I want to keep you interested because you're little kids. You don't have a huge attention span. So we want about really dragged out vowels, that once upon a time in a land far away. Literally bring up a fairy tale, okay, and read that out loud and try to really get this kindergarten kind of teaching sound. Yeah? And we're going to flow from one to the other. Yeah? And then at the opposite end, if we're going for like a more masculine speech pattern, all right, try imagining that you are President Obama and you're giving a big speech, like a State of the Union or something, okay? And you're going to be talking about the economy. And you're going to go like this, and then you're going to go like this. And we're going to talk about the state of the economy, the state of global affairs, and the state of this. Or like a news anchor. Hello, this is me, Zara, with today's news. I'm going to go over here sometimes, because wow, this is really shocking. And then I'm going to go down here, okay? Because this is like, yeah. Obviously, that's a lot more jumping around a pitch. I just wanted to like dramatize that for you. But less pitch movements and jump in your pitch movements, okay? For that more masculine pattern. Whereas for the feminine, flow from one pitch to the other. Yeah? Does that make sense to people? I know that's a ton of information at once, but use those two characters to help you do this. And hopefully that just stitches everything together into something that's much more intuitive. Yeah, the screen's going to go blurry sometimes. It's a Discord thing. I think it's when we get enough people into the call, Discord starts to struggle. So it's a Discord thing. I can't do much about it, I'm afraid. Yes, kindergarten teacher is definitely too much. We're really dramatizing it. So then when we bring it back into normal speech, you can just kind of do it like this. You can still hear elements of that within my speech. So I'm still dragging out some of those vowels. And if you were to re-listen to this VOD, with that in mind, you can still hear it in my speech pattern. I've just made it less intense. But to practice, start off with that really intense, where we're really stretching these things out and we're flowing from one pitch all the way over to the other pitch, okay? Use that for your practice and then bring it into normal speech. Yeah, if it was a graph, masculine pitch would have lines with sharp angles, feminine pitch would have smooth angles, yeah. Oh, I'm so sorry the stream quality is melted. Unfortunately, there's nothing I can do about it. Yeah, it's just because Discord, we've got that many people in for Discord now that it's going to struggle. If you head over to my Discord, it's going to be a bit better for you. Or if you watch on YouTube, then that's going to be better as well. What you could do is literally, I've set the latency to as low as possible. So you could open up the YouTube, mute it. Oh, it fixed itself. Okay, there you go. Yeah, Discord be like that sometimes. Unfortunately, there's nothing I can do about it. Okay, I'm just going through questions that I've missed. You'd really like to figure out how to have a queer-sounding masculine voice. I enjoy having a lot of pitch movement, but you know that at least where you are right now, it really hurts your chances of reading mask. Okay, so if you're wanting like a queer-sounding mask voice, you want to use a feminine speech pattern with a masculine resonance and weight, okay? So if you're kind of talking like over here, but you're really you're going for that more feminine speech pattern. God, it's even hard for me to do. If you're ever around Talia does a really good job of it. But yeah, if you go for like a masculine voice with that kind of feminine speech pattern, I just can't do it. I'm sorry, I need to practice that more. But that'll help you plug into that kind of a voice. Yeah, that's going to take some practice, Sander. Yeah, it's just going to be a matter of dropping that monotony and increasing that pitch movement while still in that masculine posture. It's just going to be a practice thing. Stream melting again? Yep, it's going to be like that. Oh, and it's back again. It's, yeah. Discord do be like that. Okay, do we have any other questions about the articulation stuff? Because I know that it can feel overwhelming at first. It's kind of one where as soon as you get going with it, it'll be like, oh, okay, and it'll all click together. You're welcome, Xander.
One more question about the articulation.
Yeah, go for it.
Sorry I keep voice questions so much, but I feel like it helps me get it out better. How would I put in stuff like the sharpness or vowel elongation to my speech? So if I say the word about, would I go about or
yeah? So if you're doing for practicing, try to go a really dramatized version. Okay, so we could literally be like about. Okay.
About.
Yeah, exactly. Do you hear how? Do you hear how almost imagine monkey bars, like a kid's play gym or whatever, okay? We're swinging from one bar to the other. Grab the consonant and swing through the vowel, okay? About. Yeah?
Well, yeah, and also, how would you incorporate the sharpness into it? Would you hey, how's it go? I don't...
Yeah, so that's going to be another thing where it's going to take a while to get used to. It's just going to be a matter of very precise pronunciation and sort of use that hi-hat exercise to get the mouth shape and stuff, and then just kind of talk like that with very precise and sharp D's and T's, where it's not like a ch, it's like a t. Yeah.
Oh, so sharp pronunciation, in those kind of business commercials where it's just a sharp speaking voice.
Exactly that. Yeah. Yeah.
Just fat American healthcare commercials where it's just fast speaking voice about all the horrible side effects while the characters are happy.
Yeah. Yes, you don't necessarily need the speed of that, but that precision and that sharpness to it. That's what I'm going for there. But again, bringing all of this, if you plug into that kindergarten teacher, this will bring all of that into a single voice. So it can kind of just be easier for you to think about. If you just know you're doing that voice, all of these things will come into it naturally.
Be cautious about taking Get Better Free. Side effects include liver burning up, inside bleeding, and even more.
Yeah, so that's very sharp.
Please speak to your doctor about taking Get Better Free. Chances of catching cancer could rise.
Yep, perfect. That's perfect sharpness. So,
this kind of...
to bring it into your normal voice, just slow that down, and you're going to have a nice and sharp voice.
So if I just slow it down more into a normal voice, kind of sharpness, it's part of kind of interrupting the words you speak with and own more of your words. It's interrupting kind of your words, sort of part of that. Also, the screen's back again. Is interrupting words part of that, or is it
I think it's more just it's not that it's a part of it. It's more that it's like an emergent property. It will happen as a result. It's not the thing we're targeting, but because you are pronouncing things very clearly and very precisely, it's going to end up happening, and that's okay.
You kind of do sharpness on the beginning and the end, or is it the
it's
middle
the
part
specific type of letter. that t or d or k, those kind of like those kinds of sounds, those consonants are gonna be what it is.
So with the more muddy voice, it would be like ta da. But it would be with the sharper voice, it would be like ta da.
It's not the speed of it necessarily. It's the listen to this t or t t or ch ch. Can you hear it like tss versus tss? Like if you do T S is sharp, T C H is muddy.
T.
As in like ch. That like the sound that is like T S or like T S S S. That's like sharp. Like that tss is sharp. That ch is muddy.
Oh, so like that, like, or just like.
Yeah, t t t.
Thank you.
Yeah, you're very well. Yeah. It's not that we're just. I'm worried that you're focusing too much on it just being the beginning of a sound. Listen to ch versus t. Yeah, so it's not thank you. It's
Thank you.
like you can still say thank you or whatever. I mean that's a th sound. It's a different kind of a sound. But like two versus two. Do you hear like ch versus tss?
Two. So like thank you.
Yeah, that sounded quite sharp to me. Because like the K sounded quite sharp there.
I'm trying my best. I'm still very new at this.
Yeah, it's okay. It's okay.
A few minutes ago.
Honestly, like this is the very advanced stuff. This is like if you've gotten through everything and you're still not quite satisfied. Most people with the articulation stuff or like the speech pattern stuff, it'll just kind of come naturally. But for some people, it just kind of won't. I was someone who it just kind of didn't. But most people, because they know they're going feminine, they'll automatically switch to a feminine speech pattern. It's just for people that doesn't happen for.
Is it required? Is sharpness required to be like more sounding femme or whatever?
Kinda. It's a more feminine speech pattern. And like you're gonna have you're gonna have women that speak in a muddier tone. It's just gonna be less common. And you probably associate it with femininity more.
So
it'll help.
So if I were to speak more like upright, kind of like this, instead of like this mudding around or like whatever,
Yeah.
is that muddy or does it still sound kind of sharp?
Wait. The more precise kind of thing is the sharper. That is what you're going for. If you're going for that muddier, then it is that kind of everything kind of blending into each other, and it's almost like a lazier kind of speech pattern.
So kind of like more precise, like that.
So more precise is going to be sharper usually.
Nice. Is there also like other videos you recommend on like more understanding sharpness better?
Yeah. So for sharpness specifically, Trans Voice Lessons on YouTube literally have a sharpness video. Clover goes all the way through sharpness. So just on YouTube, or if somebody can link it now, on YouTube, Trans Voice Lessons, there's literally a sharpness video where we'll spend like 20 minutes going through it.
Okay. Thank you.
Yep, you're very, very welcome. Any other questions about speech pattern stuff? Again, for most people, this will come naturally, but some people it doesn't. For me, it didn't. Thank you, Kazoo has just linked it there. Yeah, Mika, you got a question? Go ahead.
Alright, so after all the articulation and all that, and I think I still sound childish, is there
Really?
anything else? Yeah.
I'm not hearing childish at all in your voice. I'm not sure. I don't know. And it sounds like nobody in chat is either. This might be brainworms. Let me.
It could be.
We'll test it.
I have a big complex about it, so.
Okay, I'm super not hearing that in your voice at all. My suspicion is that this is brainworms. I think you have a very lovely sounding voice there. You sound like a young lady, like somewhere in her 20s.
I've won.
Yeah, I think
I
yeah,
did it.
you've got it.
All right. And I just practice this.
Yeah,
Practice. Fuck.
what you're doing right now is perfect.
That sounds
Sorry.
amazing.
I forgot you can't swear because the.
It's not a big deal,
Academy.
don't worry.
All right.
But yeah,
Thank you.
yeah, no worries. Good luck with that. Also, look in chat right now. You'll notice everybody else. Oh, bless. Okay. Any other questions? How can you sound like her? So she had a lovely bright resonance and a lovely light voice. So that's going to be our main two things. It's already leaving my mind because I'm too focused on other stuff. Start with those are going to be your main things. Like she had a very full voice as well. It was like a perfect full voice. Yeah, you can ask a question once stream is off, Talia. You will still voice. Any other questions about articulation stuff and speech pattern stuff?
I'm a little bit nervous, but like, okay, so I have a question because most people say I like sound like a femboy, but like I don't know how to do my voice differently. Like more femininely.
I think you could maybe brighten resonance a little bit. I think you could brighten it a little bit. All these people saying femboy voice. I don't.
Yeah.
What is a femboy voice?
I don't know, but that's what I hear like so many fucking times. That's like what
I
I've
hear
in
so
class.
much dark resonance. It's really, I think it's your resonance. Sorry to interrupt, but like,
Yeah, it's okay.
Sorry.
Yeah, so I think resonance is definitely going to be something that's going to help you out there.
Okay.
Yeah, I'm not familiar with femboy voice. I need to watch more Finster, I guess. But yeah, try brightening that resonance and see what that gets you.
Okay.
I think you're like on the right track though.
Okay. Thanks.
Yeah, no worries. Any other questions? If not, then we'll go over to for just the one-on-one section. Yeah, I know. Finster's voice is just a modified mask. Although apparently give him a month or two and it won't be. How to balance pitch and resonance. I'm going to save that for just a moment. Oh wait, but there is no balancing pitch and resonance. They're just totally independent. Do whatever you want with pitch. How do you fix it? So if you go back and rewatch a bit of a VOD where we went over resonance, just do your big dog, little dog, and try to get that brightness coming back in. Okay, I'm not seeing any other articulation questions, and it sounds like we're having a bunch of people wanting one-on-one questions, so we can move over to that. Boo, 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 boo. Let me just read this. Okay, let's move over to the one-on-one section. Boo, 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 boo. That's what I want. Okie dokie.
There's this question I've been having for quite a while.
Yeah, go for it.
All right, here you go. It's a long question.
Oh, it's in chat. Sorry.
Yeah, sorry.
I should be reading this out loud. Why am I reading it in my head? Hang on, let me start again. In your voice, you notice a really annoying quality, and like you said, you don't know where it comes from. When you compare your voice to a cis girl's sounds warmer. Yours, you feel, sounds sharp and lacking almost like a sort of depth. It's lacking warmth, feels cold, like a metal knife inside a comfy pillow. Hard to explain. It's not brightness, not weight, it's not fullness either, you think. There's just something really sharp and cold about it. Neither weight nor resonance seem to affect it. Some people have told you that it's something about your voice that you can't change, something you was born with. But I don't think that's right. It's not right. Some say that others can't. Wait, what? Some say that others say it can be changed, but they don't know how. Yes, okay. Tell you what, can I get you to read out just that first bit? You can stop at like warmer, just so I can hear your voice, just to give me something to listen to.
Sure. In my voice, I notice a really annoying quality, and like I said, I don't know where it's coming from. When I compare my voice to a cis girl sounds warmer. Mine, in comparison, sounds sharp, like it's lacking depth, it's lacking warmth. It feels cold, like a metal knife instead of a comfy pillow. It's really hard to explain.
Okay. Because it sounds kind of okay to me. Can you tell me more about this sound?
Okay, so let's try. It's really hard to explain. Like I said, it's like this. How do I?
Just go with what sounds intuitive to you, and let's just hear as you describe it.
I've already used all the words I would use to describe it. It's like
my
voice is like a metal cold knife. It's like
okay, can I pause you real quick? What I am hearing is a lot of constriction. Okay, now that I'm hearing you talking a bit more, I'm hearing a ton of constriction coming into your voice. You're almost kind of talking kind of like this, and it's like really, really constricted. This is kind of what I'm hearing in your voice. Does it feel constricted?
Yes, a bit. And
Yeah?
I can try to reduce that like somewhere around here. And I hope that helps a bit. But
hang on, let me.
I don't know if that's what I meant. I think that's just masking what I mean.
Sorry, say that again?
I don't think that's the quality that I meant. I think it's just masking what I mean. Let me try to reduce that constriction real quick. 1, 2, 3, 4. Yeah, going to extreme and then reducing it. Hopefully that works. Yeah, it's like I don't know how to describe it. It's so weird.
Okay.
It's just
I'm gonna be real. I'm not sure.
yeah, no one is.
Yeah, I can't tell what it is. I think I know what it is. I think I hear it. I'm not quite sure. Or like I'm hearing things in your voice. I'm hearing like an American accent. I'm not hearing a ton of pitch movement. Like there is some, but it's a little monotonous. Might be that. You might find that maybe, like Beth is suggesting, maybe the baseline pitch. So you could try. Let's try. Let me get my thing. I'm just gonna. Yeah, we'll go for a G sharp 3. Okay. Try, so this tone here. I think it needs to be slightly higher. Okay. And now let's go back. So if you want to either just, if you can talk ad lib, or if you want to reread some of that.
In the pitch or in the G3?
Yeah, so basically I want that to be your baseline. If you need to, start like perfectly monotonous in that G sharp 3 and then start introducing the pitch movement. Or if you think you can do it easily, then just have that as your baseline and all the movements with that being the baseline. Does that make sense?
Yeah.
Mm-hmm.
In my voice, I notice a really annoying quality, and like I said, I don't know where it's coming from. When I compare my voice to a cis girl's sounds warmer, nicer. Mine in comparison sounds sharp, like it's lacking depth. It's lacking warmth. It feels cold, like a metal knife instead of a comfy pillow. It's really hard to explain.
Yeah, I don't think it's a pitch.
Nope.
What is this? What are we hearing? Collective knowledge. We have lots of people here. What are we hearing?
It's so hard to diagnose.
There's definitely tension. I'm hearing a lot of tension. And that might